Wait for video.
Sorry, hold on one second there.
Good morning. Welcome to the Thurston County Board of County Commissioners Agenda Setting Work Session for Tuesday, August 2nd, 2022. It's 9:03 a.m. My name is Ty Menser, Vice Chair of the Board. Commissioner Gary Edwards is to my left, Assistant County Manager Robin Campbell to my right. Our Chair, Commissioner Mejia, will be present shortly. For virtual public attendance, you may follow along on the Thurston County YouTube channel. Just going to jump right into it. We have a lot to cover today. Item 1 is Public Health and Social Services Infectious Disease Update. Kurt Harden, Interim Director of Public Health and Social Services. I also see our County Health Officer, Dr. Abdullah. Good morning.
Good morning, Commissioners. Kurt Harden, Public Health and Social Services Interim Director. What we're going to do is we're going to give you an infectious disease update. We'll start with COVID, and then we'll go ahead and transition into monkeypox as an update for you. And we are doing the COVID updates on a monthly basis. I am going to start off and say that I think we'll do all the infectious disease updates, which will be monkeypox and COVID for now, on a monthly basis unless otherwise needed. Thurston County cases, our cases for COVID are all as of July 31st. We had 56,742 cases in Thurston County as reported by the state. Unfortunately, we've had 446 deaths in Thurston County as of July 31st, as reported by the state as well. Our 14-day per 100,000 case rate is 395.9. To give you a little bit of perspective, when we briefed you last in the last Tuesday in June, it was 429.9, and so it has dropped somewhat. And the high was 516.5. That was on June 5th. So just giving you some perspective there on our 14-day per 100,000 case rate. Our hospitalization data is as of July 31st. And we've had a total since the pandemic started of 2,671 people hospitalized with COVID. As of July 31st, we have 30 patients in the local area hospitals with COVID. That relates to our number of 26 that we reported back on June 27th. So again, about the same number there for patients that have been admitted with COVID. The number of patients on ventilators for COVID are 2. Our ICU bed available and capacity is 9 adults beds, and then our acute bed available capacity for adults is 12. Our congregate care outbreaks, this data is as of July 29th. We've had 258 congregate care outbreaks since March of 2020 when the pandemic started. And then we currently have 41 ongoing congregate care outbreaks that are being investigated. For vaccination status, total vaccine doses in Thurston County as of July 30th are 557,729. The percent of people initiating vaccination in Thurston County is 73.7%. The percent of people fully vaccinated is 66.7%. Percent of people initiating vaccination who are age 16 and older is 83.4%. The percentage of people fully vaccinated age 16 and older is 75.8%. The percent of people, the population initiating vaccine who are 6 months and older is 74.1%, and the percentage of population fully vaccinated age 6 months and older is 67.1%. And then the percentage of eligible people receiving a booster shot age 5 and up is 58.1%. Again, all those numbers and those vaccination statistics are as of July 30th, 2022. A couple additional items are vaccination clinics. We have a vaccine clinic today, Tuesday, August 2nd, 10 a.m. to 4 p.m. This clinic is for ages 5 years and older at Mountain View Elementary School, and it's located at 1900 College Street Southeast in Lacey. Tomorrow, on Wednesday, August 3rd, we have a vaccine clinic from 10 a.m. to 4 p.m. This clinic is for ages 6 years and older, and it's located at Timberline High School. The clinic is, the address is 6210 Mullen Road, Southeast in Lacey. On Thursday, we have a vaccine clinic from 10 to 4. And this is for ages 5 years and older, and it's at the Family and Youth Resource Center located at 200 Sleater Kenny Road, Northeast in Olympia. On Friday, August 5th, we'll have a vaccine clinic from 11 to 4. This is for ages 6 months to 5 years old, and it's located at the Tenino Food Bank. That address is 224 Sussex Avenue East in Tenino. And then this Saturday, August 6th, we'll have a clinic 10 a.m. to 4 p.m. at our Lily Road, Public Health Lily Road location. This is for ages 6 months to 5 years. And our Lily Road location is 412 Lily Road Northeast in Olympia. And again, all of these locations are on our website, and we encourage people to make appointments going to our website. But obviously, if we have space, we will welcome walk-ins. For testing, we continue to have strike teams that are available to utilize for congregate care outbreaks and to do testing. And again, test kits are available for the general public by calling Public Health and Social Services at 360-867-2610. And then now I'll turn it over to Dr. Abdulmalik for her portion of the COVID update.
Good morning, commissioners. I did want to share a little bit of good news regarding the COVID-19 pandemic. Our overall case rates have been downtrending. As of today, we're at 181.1 cases per 100,000 over the past 7 days, and 395.9 cases per 100,000 over the last 14 days. The estimate in terms of the R0, which is the number of folks that somebody who's infected with COVID is anticipated to go on to infect, is at the most recent evidence of the most recent data, which does lag a little bit just because we have to work with, the state has to work with confirmed cases, and then there's some modeling data as well, is 0.93, and that's with data as of the beginning of July. I did want to share that the CDC last Thursday reported that the Thurston County community level of COVID-19, which is a composite score or a composite evaluation based on both transmission levels as well as hospitalization rates of COVID positive patients. So the CDC stated that Thurston County is at a low community level for COVID-19 as of last Thursday, with 8.9 new hospital admissions per 100,000 population over 7 days that were positive for COVID-19. So I did want to share that. The last time we met, we were at a high community level, and that changed last Thursday because case rates are really only account for cases that are account for tests that are performed by CLIA waived or CLIA licensed facilities. We continue to watch the situation closely because at-home tests, when reported, are reported differently and in alignment with federal standards, are not included in these numbers. So we are cautiously optimistic and watching our situation here in Thurston closely. At this point in time, our most recent surveillance data shows that the most commonly circulating variant in Washington State is the BA.5 variant, and that would account for 79.8% of cases. And this is from the most recent DOH report from July 27th, but includes testing results through July 16th. I did want to share another piece of exciting information, which is that there is a new vaccine that's available for those 18 and older for COVID, the Novavax Vaccine. It's a protein subunit vaccine, which uses pieces of viral protein and an adjuvant to help the body mount an immune response to COVID. It's also a 2-dose vaccine with doses given 3 to 8 weeks apart. We anticipate integrating this into our offerings, and folks, vaccine providers in our community who are interested can reach out to us if they'd like to request doses to administer in their practices, provided that they've enrolled with the state to be a part of the COVID vaccine response. And with that, I'm open to any questions you may have. Thank you so much, commissioners.
Commissioner Edwards.
Doctor, on your level that you're referring to, we were high at one point, now we're at low. How many levels are there? Is there very high, high, medium, low, very low? What's the categories that we could hope to attain?
Yeah, so for community level, there's really 3 categories.
Oh, okay.
There's low, medium, and high. In terms of our trajectory, first, our cases increased to more than 200 cases per 100,000 over 7 days, and that bumped us up into medium. Also, if there are an increase in hospitalizations without a reported increase in cases, that can also bump a county up into medium. If you have high cases and high hospitalizations, that would denote a high community level. We're fortunate at this time that both our transmission rates and our hospitalization rates are low, but we continue to watch.
Oh, okay, thank you. I have one more question. The media over the last couple of days has been promoting, I believe it's a state call in so that you can explain your symptoms to someone. And then apparently they're going to prescribe at no cost to citizens a treatment regimen. And I'm curious, is that something you go to the drugstore and pick that treatment up? Do they mail it to you? And the reason I'm asking that is it seems like time is very crucial when you're getting that treatment if you do come down with symptoms. So could you explain that to the public and maybe throw a phone number up on what that phone number might be and just a little bit about it?
Yes, definitely. So the Washington State Department of Health has started no-cost telehealth for folks who've tested positive for COVID-19. These are telehealth visits and can be accessed either online or by calling a phone number. So after you have your consultation, if you meet the requirements for needing Paxlovid, then a prescription is written and then you can have somebody pick it up from a participating pharmacy. We do have the information up on our website, and I can definitely look to see if I can put up the phone number for the public, but it'll take me just a moment.
Okay. Okay, if you could, though, I think that might be helpful for those that are watching that are concerned. Thank you.
Dr. Abdul, so my question is about you had, I think a couple of weeks ago, a recommendation for masking within indoor public areas, and that aligned with the CDC, and that I think was connected to our high rating. And so now this low rating, is your recommendation on that going to change, or are you going to wait to for a longer period of data, or what would you be looking for to alter that recommendation?
So while I continue to recommend that folks consider their individual risk of severe disease from COVID-19 and the risk of others that they might transmit to, and making masking decisions at this point. I personally do continue to mask in public indoor spaces. At this point, I think that I recommend that individuals do a self-assessment of their individual risks, both of severe disease and of folks that they come into contact with. In addition, of course, to following all of the state and all of the State Department of Health and Labor and Industries guidelines.
So is that, just to clarify, is that an explanation of your previous recommendation, or is this a slightly modified recommendation based on the fact that we're in low category, not high category?
This is a modified recommendation because we're in a low category rather than a high category.
Okay, very good. Thank you. My second question is about this new vaccine, which I don't think I've heard about. You called it Nova something, or what's the name of it? Just so I know what I'm hearing about when I hear about it.
Novavax.
Novavax, okay, Novavax. And I understood your description of the, 2 doses over 18 years old, some of that, but is it, you talked about the way it works. It sounds like it's somewhat different than the other vaccines. Is it more appropriate for certain populations, or is the effectiveness level look similar, or how does it stack up to the ones that we're familiar with? Pfizer, Moderna, Johnson & Johnson?
So at this point, the current data does show it as being equivalent, and it does have the ACIP, so the Advisory Committee on Immunization Practices recommendation as a primary series. So this would be for folks that haven't received a primary series yet, or for folks that couldn't take an mRNA vaccine when previously offered for a variety of reasons.
Okay, so I was just curious if there's a group that might want to seek this out, maybe you had concern about the previous kind, but this is doing something different or has a greater effectiveness level for certain populations. Sounds like not necessarily. It is appropriate kind of for the same groups and similar effectiveness and et cetera.
Yes.
Okay.
So I anticipate that we're going to, because this is rolling out. This is a new vaccine. I do anticipate that as we get more data and learn more, that we'll get more granularity and visibility on that in terms of the specific populations that might benefit. But at this point, folks who haven't had a primary series yet, that are on the fence, I strongly recommend that if they qualify for the Novavax vaccine, to strongly consider getting it.
Okay, so there's COVID.
Just one more thing, follow up on your question, sir. On these vaccines, I take it this Novavax so that's all brand new, but even the other ones, are they still being dispensed, I guess, based on emergency approval? Or are some of them through the whole system and are now just normal vaccines, and maybe this one is or it isn't? What's the deal there with, normally vaccines go through quite a regimented test, but certain ones have been given emergency approval status for the benefit of the community. So what's the deal on these? Have they passed that threshold, or are they still emergency vaccines?
So Community, which is the Pfizer vaccine, I believe that is the formulation for 12 and up, has full FDA approval, and then Spikevax, which is the trade name for the Moderna vaccine, and I believe that's for ages 18 and up, has full FDA approval at this point. I can definitely look into that and update you, but that's the most recent information as I have it.
So all of them now have full approval?
So it depends on the age group. So because the vaccine for younger age groups rolled out later, some of those formulations are still under the emergency use authorization, and haven't received full FDA approval yet. But there are formulations of both Pfizer and Moderna that have received FDA approval.
But everything now for adults, for an example, and up, well, adults, it's all been approved as regular full approval, nothing to do with emergency status anymore?
For Pfizer, for Pfizer and Moderna, that's my understanding.
Okay. Okay. Thank you.
Commissioners, a quick update. For Commissioner Edwards' question, the test to treat locator number, number one, it's on our website, so you can click on and get onto the portal. But if you want to call in, the number is 800-232-0233 for those people who want to call in on the test to treat locator and do the virtual consult with a physician.
Yeah, and maybe a clarification on that topic. Do you need to have taken a home test, or if you've got symptoms? So what should the public be expecting when they call in?
It's the first step in the criteria is to have a positive test. So if you've tested positive.
Okay, positive test, got it.
Okay, let's get to our monkeypox update. We're still on part B of number 1. Commissioner McKee is not going to be happy with me.
Okay.
I'm still on the first item when she gets here.
So I'll start off with give a general overview of the monkeypox. We're working closely with the Department of Health on the monkeypox situation. We are having within the Public Health and Social Services, our folks are doing the planning for monkeypox. I'm going to turn this over to Dr. Adam Malik to give the details of it, but and then we'll answer questions.
All right. I did want to speak a little bit about about monkeypox. So monkeypox is caused by infection with the monkeypox virus. So it's part of the same family of viruses as the virus that causes smallpox, but it doesn't result in as severe disease. The currently circulating virus in the U.S. Is the West African clade. Which is a less severe version. So monkeypox is a disease. So folks can experience a prodrome of flu-like symptoms, so fever, headache, muscle aches, backache, swollen lymph nodes, as well as fatigue. When they become ill with monkeypox, these symptoms can occur 1 to 3 days before the rash. And so often, so monkeypox does cause a rash. It can look like pimples or blisters, and it can appear, on the face, as well as other parts of the body, hands, feet, chest, and including the genitalia. The rash goes through different stages and eventually heals. This illness typically lasts 2 to 4 weeks, and people are infectious from when symptoms start until the rash is completely resolved, meaning that the scabs have fallen off and healthy skin has formed underneath where the lesions were. There are folks who are at risk of more severe disease, including people who are immunocompromised, children, as well as pregnant people. It's really spread. This is a disease that's spread through close contact. So either close contact with the lesions themselves, or with respiratory secretions. And there have been instances where folks are likely to have gotten monkeypox from touching items that someone who was infected had previously touched. So thinking about, blankets, sheets, things that are in things that have been in very close contact with someone with active disease. There is also some evidence that pregnant people can spread the virus to their fetus through the placenta. At this point in time, the disease is spreading most rapidly in the community of men who have sex with men, but we are at the national level seeing spread to household contacts as well as other folks that may have close contact with individuals during their infectious period. So in terms of the Washington State situation, as of this morning, there have been 118 cases identified in Washington State, 103 of which are in King County. We have not yet identified a case in a Thurston County resident to date, but we continue to work closely and support our local partners. In terms of what folks can do to prevent disease, avoiding skin-to-skin contact with people who have a rash, not sharing, utensils or cups or any of those things with people who are symptomatic, as well as hand hygiene. For folks that have symptoms, they should really see their healthcare provider immediately. And avoid skin-to-skin contact with others until they've been evaluated. So we are working, so there are a number of ways that healthcare providers can order tests. So there is the public health lab, for which the provider would need to coordinate with us at the local health jurisdiction to get samples sent over for testing. But there are other labs, including Quest and University of Washington, that have come online that providers can also send tests to. We just ask that when people suspect monkeypox, that just a reminder that suspect cases are an immediately notifiable condition. So just to, we just ask that providers give us a call when that happens. In terms of people who have symptoms and are awaiting the results of testing, we really recommend that they isolate at home, away from other people, and away from pets, just because there's some evidence that monkeypox can spread to other mammals. So there are two key pieces for prevention and treatment, in addition to mitigation measures previously mentioned. So in terms of prevention, there is a vaccine available in very limited supply, and that is the Jynneos vaccine, which is a viral vaccine that's not replication capable. It's a two-dose vaccination. And at this time, it's really available for close contacts of monkeypox cases. It has to be. There are two windows for which it can be given. So if given within 4 days of exposure, it can prevent, in many cases, it can prevent progression to disease. And then if given in the 4 to 14 day window, it can prevent severe disease. There hasn't been a demonstrated benefit beyond the 14-day window, and it's not recommended for folks that are already showing symptoms. There is, while most people who get monkeypox, it resolves on its own in 2 to 4 weeks, and they don't need any additional treatment. For people who are at risk for severe disease, children under 8, people who have extensive disease or aberrant disease, meaning disease on the mucous membranes, or disease or lesions in the eyes or other places. There is an antiviral medication, tecovirimat or TPOXX, that's available for folks. We just ask that providers coordinate with us. There are some screening processes and some reporting pieces associated with this antiviral treatment that we can help support providers with when they have patients that would benefit from the antiviral treatment. And with that, I'm open to any additional questions you may have. Thank you so much, commissioners.
This is gonna sound a little stupid, but you mentioned men having sex with men. Does the same thing apply with women? Or is this pretty well to the male sex versus the general population? What kind of numbers are we talking about? If we got 1,000 people that have this, are they males or are they a mixture or 90% males? What's the deal? What's the threat out there to the public so they have a better understanding?
Yes, so while this is a disease that's spread through close contact, not just sexual contact, the group that is currently most at risk are men who have sex with men, and the majority of cases thus far have been in that community. But I don't have a specific number at this time.
Okay, I do think at some point it'd be nice to be able to tell the public, 90%, 60%, I don't know, but there's probably a concern out there. So if you can get it, thank you.
Thanks.
I guess the only question I had was just, that's all good information, thank you. Because I didn't know a lot of those details. The vaccine that you described, how did that get put together so quickly? I mean, has this been something that's been around and folks, because obviously we thought the COVID vaccines were like historically quick, and it feels like this is even coming quicker.
Right. So these are vaccines that were developed for smallpox.
Oh, okay.
That are also thought to be effective against monkeypox.
Got it. Okay, thank you. Well, let's then, if there's anything else, commissioners or Kurt, are we good on this topic?
I think we are.
Okay, thanks, guys.
Thank you.
Appreciate that update. Let's go to item 2, homeless strategies, and Keely Marino, good morning.
Good morning, Commissioners. Keely Marino with Public Health and Social Services with a brief update for you today. The right-of-way efforts continue. We met this morning, and Pacific Avenue has had some of the unoccupied spaces cleaned. We are able to offer housing to up to 4 or 5 individuals, and so that offer has been made. One person has moved into Unity Commons already, and others will be offered those spaces. And once those spaces are offered, the 72-hour clock starts, and those sections will start to be cleared. So there will be some activity on Friday morning on one section of that interchange cluster around Pacific Avenue. I can get more detail on exactly which one that is. I don't have that at hand right now. So that is moving forward. We're meeting with our outreach providers and hoteling providers to develop their scopes of work. So we're looking forward to getting that underway. And then we did have a hazardous weather event last week. It was initially called for 3 days and nights, but we extended it through Saturday. We would have been able to, we were intending to spread it or to extend it all the way till Sunday, but we ran into some staffing capacity issues and we're not unfortunately able to offer that. However, we did offer shelter in place survival gear out into the encampments. Water and other cooling measures were deliver to those in the encampments. We had a volunteer training, and from that, we were able to fill every volunteer shift Tuesday through Saturday. There was a giant mountain of donations from the general public, so much gratitude for their kindness. We had nurses on every 3 days of the 5 to provide any kind of wound care or assessment. And then a total, I'm waiting for Saturday's numbers, but it averaged about 45 people per day that were accessing the shelter. And that cooling shelter was offered between 2 p.m. and 8 p.m. So a really excellent joint effort of the City of Olympia, Interfaith Works, Partners in Prevention Education, and Olympia Free Clinic. So just wanted to shout out some gratitude for them. And that is all I have for you today. Happy to take questions.
Commissioner Edwards?
Keely, how's that project coming between Olympia and Lacey, that vacant property that I guess is being turned into some kind of a RV camp or something?
Oh, the Franz Anderson property?
Yes.
That's actually,
Yes.
the City of Olympia and the county are co-owners of that property, and that is part of the right-of-way response. And so we're waiting to hear from the state auditor whether or not we can waive federal procurement processes to speed up the development of tiny homes. So there should be between 50 and 60 tiny homes on that property, and within 3 years there'd be permanent supportive housing put in place. So it's in process. We're just waiting for the word that we can move forward more swiftly from the state auditor's office.
But I guess then none of these, I'm catching a lot of flack from senior citizens about the homeless encampment with RVs over by the hospital yet.
Yeah.
And so none of those are we're not going to have any of the RVs in that property.
No.
It's all going to be the small homes.
It's going to be tiny homes. And so the folks on Ensign Road that are currently living mostly in vehicles will be moved mid-August, end of August, to the new Quint Street Village, which is owned by the City of Olympia. However, no vehicles will be allowed on that property. So the individuals who are living there currently will be offered a tiny home or to move their vehicles on. But it will be completely cleared by the end of this month, is my understanding.
Okay, thank you.
Mm-hmm.
Keely, on the very first point, when you said right of work ongoing and you were talking about 5 or 6 people you said being offered, and then that started a clock and for clearing camps. I got a little bit lost in the detail there. Can you just expand on what that clock means and how those camps are being cleared in connection with being offered space, et cetera? Absolutely.
So the way it's been operating is that Kim Condrat with the City of Olympia and her team have been going out on a daily basis to make contact with whoever's living in any of those interchanges, but at Pacific Avenue. She's created a list, a by name list of those who live there. Those names are held fast, so no new residents can move into this space while we wait for beds to become available. They have sectioned them off into, I believe, 7 different sections of the interchanges, and they are incrementally posting no trespassing as they make contact and by name list. And then I don't know if it's a municipal code or just standard practice that once an individual has been offered a place at Unity Commons at this point, that's a 72-hour window of notice. So that's pretty standard for clearing camps. City of Olympia utilizes a 72-hour clock, as does the state. So that once an offer has been made, that individual is made aware that in 72 hours, they're going to have to either move on or stay at Unity Commons because the camp will be cleared.
So what you're saying is that we're going to be moving them like individual by individual from the list as we are able to offer placements, and we've got 5 or 6 starting off, and that'll be an ongoing process as we develop these other shelter spots that the state's helping us or paying for.
Yes, correct.
Okay, I think I got it.
Yeah.
Thank you.
Mm-hmm.
Let's then move to item 3, which is reviewing this afternoon's draft agenda. And let's see, we'll kick off the meeting at 2 p.m. per normal. Pledge allegiance to be led by me. Approval review and approval of the agenda and board meeting minutes from July 26th. A presentation from pretrial services regarding a new diversion officer. And I'll just keep going unless you guys have any questions or comments there. The public will have the opportunity to address the board. County manager, or in this case, our acting county manager, Robin Campbell, will give any update.
No update.
No update will be coming, okay? And then we'll go to consent agenda. So item 3A is the sheriff's item. And actually 3A and 3B are sheriff's office items. Request for proposal, issuing award of contract for food services for the corrections facility and the juvenile detention center. And I see Under Sheriff Ray Brady here. And I know we addressed this last week, but
I have nothing to add to what you heard last week. This is a contract for food services at both the adult and the juvenile detention centers. We do go out on RFP on a intermittent basis for these services, and the current contract is about to expire. So we're going out now to see what we can get.
anything to add, Under Sheriff Brady?
Hey, good morning, Commissioners. I don't have anything to add. Like the Assistant County Manager mentioned, with a contract, I believe is due at the end of, or expires the end of November. So pretty standard practice here.
Commissioner Edwards?
I guess this would be addressed to Robin. Are we going out for one contract or two separate contracts?
Believe that the contracts are separate contracts once they are bid and awarded, because the juvenile contract has to be vetted by the Washington State Office of the Superintendent of Public Instruction.
Okay, so-
Yeah, so I can add to that if you'd like, Commissioner.
Yeah, go ahead.
So the juvenile facility has elected to piggyback on the RFP process, which is similar to what they did last time. And then once the vendor is selected from that RFP process, there will be a separate contract between the adult facility run by the sheriff's office and juvenile. But we would both use the same vendor and the same RFP process.
Okay,
We get the same rates, right.
thank you.
Okay, very good. Let's go to B then, while we've got Under Sheriff here. This is a application for the Lake Lawrence Regatta.
This is an annual event on Lake Lawrence, and they contract with the sheriff's office to provide security and other services for this event, and the undersheriff can tell us a little more.
Yeah, I'd be happy to. As was stated, this is this event has been going on for many years. We have a great working relationship with the Seattle Outboard Association that runs the event. On Lake Lawrence is one of the events that they do. And in fact, it's one of the premier lakes that this group actually uses. And so this is a pretty standard request to allow this event to occur on the lake over the weekend of September 16th through 18th.
Any questions, Commissioner?
No, I might just mention, been going on since the 50s, I know, so quite a while.
Okay, very good. Thank you, Under Sheriff Brady. Good to go on 3A and 3B, 3C's auditor voucher list. Any, well, I guess we have no atrium items.
No atrium
Any
items
questions,
on
Commissioner
this.
Edwards?
No questions.
Okay, let's go to item 4A, Cpad, set public hearing for the 2022 George open space application.
So, this is, as you stated, Commissioner, it is a motion to set a public hearing, and I'm going to ask Marissa to explain to us what the George open space application is.
Thank you, Robin. This is an application by the county's open space tax program that the board oversees. The applicants seek to enroll 12.12 of their 13.12 acres into the program as significant wildlife habitat area and resource enhancement. The Planning Commission has recommended approval of the application, and the board was briefed on this item on July 14th. And from review of the application, the property does meet criteria for enrollment for these resource categories. The property is known to support important species in the CAO. They've turned in all supporting documents and are developing a grazing management plan with NRCS. And per RCW 8434, the board is required to hold a public hearing on open space applications, after which point the board may make a decision on the application.
Oh, okay, right, we're just setting a public hearing. All right, Commissioner Edwards, questions?
No questions, sir.
Did this get a unanimous recommendation from the Planning Commission, you know, Marissa?
It did.
Okay, perfect, thank you.
Thank you.
All right, let's go to item 5A, Public Health and Social Services. Approval of Amendment Number 1, extending the contract term of the DSHS Long-Term Payable Interlocal Agreement, number 2163-23634. Kurt Harden, Interim Director of Public Health and Social Services.
Right, and I'm going to turn this straight over to Kurt.
Okay. Good morning again, Commissioners. Kurt Harden, Interim Director of Public Health and Social Services. This item is the Washington State Department of Social Health and Services, DSHS, Interlocal Long-Term Agreement, Payable Agreement, provides advanced funds in the amount of $774,651.66 to Public Health and Social Services to be utilized for the Developmental Disabilities Program. The Developmental Disabilities Program operates on a reimbursement model with monthly expenditures in excess of $500,000. The advanced fund Public Health and Social Services to pay contracted providers prior to receiving the reimbursement from DSHS, which can be up to 2 months after the services are rendered. The advanced funds allocated in this agreement allow the Developmental Disabilities Program to provide services without negatively impacting the program. In the event that the Developmental Disabilities Program discontinues services, this agreement will be terminated. Amendment 1 extends the agreement through June 30th, 2023.
So last week, Commissioner Edwards was excused, and I tried to summon his spirit by pointing out that no one's going to know what a payable, long-term payable agreement is, and I asked for the word developmental disability to be included somewhere. I don't see that happen.
The AIS description was updated to include the developmental disabilities. Were you looking for the information to be on the recommended action, Commissioner?
I wanted it on the agenda somewhere, just because that's a lot of people use to track what we're doing.
Okay.
I mean, it can just be those 2 words stuck in there in the appropriate spot.
Okay, we updated the AIS. My apologies. We will work with Jamie to update the agenda for this afternoon.
Okay, did I do a good job, Commissioner?
You did, super. I do have one follow-up.
You got it.
You mentioned about $500,000 a month. So annually, we're at about $6 million. Is that what we're hearing?
I can, if you take the 500,000, that extends out to 6 million, but I can go back and get the actual numbers for you, Commissioner, and get you the annual outlays for this. I don't have that.
I guess I don't need the actual numbers per se. This is pass-through money, right?
Right. Yes, this is pass-through money.
Okay, I mean, it sounds like there's quite a commitment here on both our part and the state's part to deal with this problem, right?
Correct.
Okay.
Anything you had, Robert?
No.
Okay, thank you, Kurt. Let's stick with you for item, or actually we got Jacinda. 5B, approval of contract with Mud Bay Consulting for HUD 2023 to 2027 Consolidated Plan. I see Tom.
Yes, good morning, Commissioners. Tom Webster. Jacinda is out today, so I will fill in for her. So this is a request to sign a contract with Mud Bay Consulting for up to $50,000. The HUD Consolidated Plan is required for the federal funding we receive from the Department of Housing and Urban Development. This plan is required every 5 years. So the plan we're looking to develop would cover the period of September 1st, 2023 through August 31st, 2027. The plan is due by July 15th of 2023. It is a process that takes 6 to 9 months to complete, so we'd like to get started this fall. We did issue an RFP earlier this year. We had 2 responsive bidders. Mud Bay was selected as the strongest applicant. So we're asking for your approval to move forward
Commissioner
with
Edwards.
this contract.
And is this also pass-through funding that covers the cost of putting this plan together?
This is an eligible under our community development block grant at home. The administrative funds we receive under these grants, we pay for it under the admin funds for these grants that we receive.
And these are dedicated funds that.
And these are dedicated funds.
Okay.
Yes, sir.
And these folks are kind of like the experts on putting plans together and streamlining the process.
Yes. Yeah, this person is actually based in Snohomish County, and he's developed common plans for several other communities throughout Washington State.
Okay, thank you, sir.
We learned last week that apparently Whatcom, or somewhere up north, I thought it was Whatcom, also has a mud bay, so this is not a local firm, which I would have assumed by that name. Okay, so we're good on that one. Let's go to item 6A, Public Works Description, approve project prospectus and local agency agreement for the countywide electrical services project. Bill Richardson, Associate Civil Engineer. Robin, do you have an introduction?
I'm sorry, so this item is to sign an agreement for countywide electrical services project, and I'm going to ask Bill to tell us a little more about it.
Hi, so this is a 100% fully funded by the federal HSIP grant, so Highway Safety Improvement Grant. It will be improving intersections and roadways throughout the county. We have a county road, local road safety plan that develops which roads get this treatment. We'll have speed feedback signs, lane narrowing, streetlights at intersections, things like that. So we have $1,465,000 in HSIP funding for this project. So we're asking for the board to authorize the Director of Public Works to execute the project prospectus and local agency agreement with WashDOT and subsequent amendments and supplements.
And Bill, is this motion to accept the grant award from the Department of Transportation?
It's to execute the project prospectus. So yeah, it's to get the funding going essentially for our design.
Thank you.
Commissioner Edwards?
So this is basically a safety issue for drivers, maybe, and pedestrians?
It's mostly driving, but we do lighting at intersections, so that will help with pedestrian safety as well, yes.
I wonder if we couldn't follow back on that explanation issue of being able to add something that does say to improve safety for our, I don't know, roadway use or for the motoring traffic, I don't know. Somehow to let the public know, because it is a little bit confusing on what it might mean. Does it mean traffic lights? Does it mean speed zone ahead for school zones? What all does it cover? But I understand it's mostly safety related.
Yes, it's all safety related. So speed feedback signs are the signs that will tell you how fast a vehicle is traveling. So it kind of warns you of like, oh, you're going too fast in a 25, it'll trigger your actual speed. Lane narrowing is skinning up lanes as you come into intersections so that drivers will slow down, essentially coming in intersections. So that will improve safety for driving as well as any pedestrians, because drivers will hopefully be going slower, as well as street lights at intersections. So it's not like stoplights, it's the actual visible lighting at intersections to increase visibility.
And just roughly, what's the dollar amount that we're talking about investing into that safety program?
$1,465,000 is what the HSIP grant is giving us, and that is 100% federal funds. So we will not be investing beyond that.
I guess going back to what Commissioner Mentzer said, as far as keeping the public informed when they'd like to know what we're doing, and letting them know that we've applied for and apparently received over $1 million in safety upgrades. I think that's worth mentioning somewhere in there. I
I
don't
have a
know.
suggestion maybe.
Yeah.
So right after local agency agreement and the action,
Mhm.
you could add the words for traffic safety improvements
There you go.
with the Washington State, and that might cover it.
Yeah, just kind of a little bit more explanatory. I mean, we get it, but we're trying to be as open as we can. So.
Okay, I don't have any questions, Bill, thank you.
Thank you.
And then, wow, Commissioner Edwards, you're getting off easy. I think we had like 100 items last week. And this one is pretty short, so we'll have our standing items, 7, commissioners' reports, county manager reviewing our schedule, and then we will have a public hearing at 3 o'clock.
Yes.
It
this-
probably will not be the 2-hour extravaganza on Patterson Lake,
No,
but it will be on something a little more technical. Amending Thurston County Code relating to public records index and cost for providing copies of public records.
yes, this is a public hearing for the board to hear any comments related to amending the county code to allow for charges for public records requests related to body-worn camera records. And the undersheriff can tell us a little more about this.
Yeah, as we've talked about in a few previous meetings when we were setting this public hearing date. So currently the county code does not cover PDR costs associated with body-worn cameras. As you know, you provided funding to the sheriff's office for the purchase and acquisition of body-worn cameras, which should be going live here hopefully within the next few months. And as a result of this, we work closely with Karen Horowitz in the prosecutor's office, who's in charge of the PDR section for the county. And so this is a request which requires a public hearing to change the county code to allow for the billing of PDR fees as a result of working with those, and is pursuant to state law, which allows for that, and as well as some areas that are specifically provided as exemptions from people paying those fees under certain circumstances as identified by law.
Commissioner Edwards, anything there?
I guess I'd just mention that this is part of the legislative changes involving, I guess, accountability on law enforcement, I guess, and the cost associated with it, I think, right?
Yeah, so why it certainly wasn't, passed directly into law requiring the use of body-worn cameras. Certainly a lot of the legislative changes over the last 2 years are heavily steered in that direction. And this funding actually for this program actually came from the state under basically unfunded mandate funding that came for that. So we were able to purchase these using those state funds. And we're really excited about it over here at the sheriff's office. We definitely think that these cameras will provide better transparency for our employees and for the public as well. So I think it'll be a good thing moving forward.
Thank you.
Yeah, I would just add to that funding that Under Sheriff Brady mentioned could have gone to various things, but the sheriff's office was really excited about having this. So we were, we agreed to spend the money in that way, and it was a good way to get them something they needed, and hopefully will really benefit the community at large. So, but anyway, this is kind of a necessary piece of the administration of the public records, and I don't have any questions on that. We'll have that today at 3 o'clock, and then we will have, I will mention right now, we will have a 4 o'clock Board of Health special meeting, but that's going to be discussed later in today's agenda as to what that's all about. So thank you, Under Sheriff Brady. So then let's move to our 4th item today, which is reviewing next week's proposed agenda. That meeting will be called to order at 2 p.m. Commissioner Edwards will lead Pledge of Allegiance. We'll have consideration of agenda and minutes from today. Opportunity for the public to address the board. County manager's update. And we'll have county manager back in the saddle next week.
Yes,
Okay?
we will.
That'll be nice. Hope he's doing
Yes.
well. All right, then we have consent item 3A, and I believe the treasurer is here for this one. It's authorizing the sale of tax title property to Casa Bella Properties LLC. County Treasurer Jeff Gadman, good morning.
Good morning. Thank you very much for your time this morning and consideration of this item for next week. So this is a property that became tax title in 2016. If you look, there's a map in your packet and you show that this is an unopened section of St. Clair Drive that was originally in the plat of Scenic Shores.
Can we hold you up for 1 second to make sure we have?
The map is not in your packet, although Treasurer Gadman did attach them to the AIS. I will see if I can pull the map up on the, can't get it up on the screen because I'm not on the screen. Jamie, could you please pull up the map? I can certainly send it to the
I've got
Yeah.
a copy that you could, if you want to, yeah.
Appreciate that.
Thank you, David.
Yeah, kind of for the public awareness as well.
Right. So basically the right-of-way, the entire right-of-way is 60 feet wide. And years ago, the person who's offering to purchase this particular parcel purchased the north half of that right-of-way, which is 30 feet wide. He bought it as part of a package of other properties he bought. Now this is the southern 30 feet of this right-of-way. And since he owns the adjacent north piece, he wants to buy the south piece. So it's a 35-foot wide, or 30-foot wide strip of property. It is 0.32 acres, and he is offering to pay $2,000 for this property. At the time that it went up for auction for property taxes, there were $300 in taxes owed. So basically, he's paying over the minimum, and I would recommend that the commissioners allow this sale to go through.
No questions. I applaud your efforts to put things back on the tax rolls. Thank you.
How do you, I mean, I'm not remembering having a situation where we were dealing with like a right of way in that sense. I mean, is that unusual to have that, like who owned it before?
It was a private owner.
They had
At
the
some
private owner.
point, this piece of the right-of-way was never built into a road. At some point, this piece of right-of-way got split in half.
Oh, okay, so even though this map's showing me Lake St. Clair Drive, there isn't a road there.
So at the very end of this parcel is where the paved roadway ends. And so on the eastern part of
Not
the
at the pointed end, but on the blunt end.
blunt end, yes. And all of the properties there, all the houses have access, so the road is unnecessary. So, and that may be why it was never built. I don't know. I tried to do some research and just ran out of time.
Do you know, does the person buying this, that property that is kind of longer property in there that's ending in 701, where's their access at if this property is sold?
So they have, so if you look on the left edge of the map,
Yes.
Lake St. Clair Drive Southeast, that is developed, and that's where that property is accessed from.
Yeah, but I don't know, I mean, it just looks like,
It doesn't show, yeah, it doesn't show that.
it doesn't show there's gonna be any access to that 701 property.
No, they have access, and the other thing is, even if you somehow end up with a property in the state of Washington that's quote-unquote landlocked, you can't have landlocked property in Washington. The courts will award you an easement over neighboring properties to get you access.
Every one of these properties that I've looked into that you brought before the board over the last so many years has always been completely thought out by your office. I want to point that out. I've looked into a lot of them. Thank you.
Thank you.
All right, good to go. Thank you.
All right, thank you for your time.
Okay, then we'll look at 3B is another voucher list, and we'll have a chance to look at that later in the week. So on item 4A, it's emergency services item, FEMA Public Assistance Grant Agreement. I won't read out the contract number. It's funding for January 2020 flood response. And Ben Miller-Todd, he's interim emergency management.
He is here. This is an agreement with the Washington State Military Department, who also houses the Washington State Emergency Management Division. And the agreement is to reimburse the county for flood response costs under the FEMA Public Assistance Program. And Todd, or Ben, do you have anything to add?
I would just remind both of the commissioners that this is for flooding that occurred in January 2020. So this isn't the most recent round of flooding from January 2022. This was January 2020, where we had minor to moderate flooding along the Nisqually. The Washington State Military Department reached out because they still had funds available, grant funds available to help cover some of these costs. And so it's a 75-25 match that we've identified some projects that would qualify.
What's the date of the 24 mean there? Why does it say it goes to the April 24?
So for FEMA assistant grants and those agreements, they usually run for an extended period of time as you're gathering information to apply or amend those grants for projects that would qualify. So many times they'll actually start at the date of when the emergency was identified. And at this point, it was the date of the flooding, January 20th, 2020. And then they'll run it for a number of years in order to gather all the information that you would need to submit for reimbursement off the grant.
Oh, okay. So if we didn't have the money to do the reconstruction until we got this grant, then we're given time to then deploy the money and then ask for reimbursement.
And identify eligible costs. And so to identify those costs sometimes takes an extended period of time, and then we would submit for amendments to this grant. And so that's why you see also associated amendments in the motion.
Ben, is this to help out property owners or the taxpayers of Thurston County on maybe a bridge or a culvert or whatever it is?
So I would say anytime that we're able to garner federal funds, we're helping out the taxpayers. That's a little bit of an opinion, but it puts it back into the local, moves that federal money into to our local coffers. However, this is specifically related to public assistance. And so this is when you go out for a FEMA public assistance and when you qualify for X amount of damage that was done within a county or a state, you can apply to the federal government for what's called FEMA public assistance. And so this is directly related to the costs that were incurred by the county and not directly related to those that were affected by the floods.
So, and I realize, and I have for years, that the term public assistance may be a little confusing because under FEMA's terminology, public assistance means government entities. It is not grants or awards to the public.
Directly.
Right, it's
no
not to our
individual
citizens, that's
assistance.
correct.
That's a good
So
question.
this is money that comes to the government to cover government costs.
Which are public in a different
Public, yes,
definition
it's
of
public
public.
in that nature.
Because I know people are still watching from down there as to what kind of, I don't know, benefit they're gonna get for the
Right,
damages that
to
they.
their own properties.
Yeah, to their
That
own
is-
individual problem.
That is under an individual assistance
Okay.
program under FEMA, often covered by flood insurance. Ben, do you know if the individual assistance program was approved by FEMA for this particular event?
I can research that for you, but I do not believe that it met the individual assistance threshold,
Correct.
which is much higher than the public assistance threshold.
Right.
Commissioners, I can jump in here real quick. It did not meet the threshold for individual assistance, and there was not a declaration for individual assistance. However, the county assistance to individuals may be eligible depending on FEMA's approval process for such as we had dumpsters out there, we had removal of debris where people brought their debris to a dumpster and to a location. That potentially could be eligible. So even though the county's getting reimbursed for that, that cost that the county incurred that helps citizens out there may also be beneficial as well.
I guess I might bring up that the community down there is still concerned about those potential flooding issues that might develop and have put in an appeal to FERC, I believe it is, asking that Tacoma Power at least have some, that there be some regulatory oversight about flooding issues, even though the Alder Lake Dam is not a flood control dam, but they're asking for some type of regulatory oversight. That's what I can tell you right now. And there'll be more information coming on that soon. I might mention that along with this.
Okay, thank you, Commissioner. Thank you, Ben.
Thank you.
The next item is public defense, and even though it's here as a new item, this is actually an item we've reviewed a couple of times and it got pulled from a previous agenda and replaced because it wasn't quite ready. So just to remind commissioners, we have seen this. It's an interlocal agreement amendment for City of Tumwater Indigent Defense Legal Services, and
Yes.
I don't see public defense here, but maybe that's because we've reviewed this a couple of times.
So we'll, this is next week's agenda. I'm sure Patrick will be able to join us at that time. This is a contract with the City of Tumwater. Tumwater contracts with our Office of Public Defense to provide defense attorney counsel to defendants who are deemed indigent in the City of Tumwater. We've been doing this contract for a number of years. This is just a continuation of the current practice.
Anything to add today, Commissioner?
No,
Okay.
thank you.
All right, then let's go to let's try to finish today's agenda, or this agenda, and then we'll take a break. 6A is a Public Health and Social Services 2022 Additional Consolidated Homeless Grant Housing Contracts. Tom Webster from Public Health and Social Services here to explain it.
Yep, and turn it straight over to Tom.
Great. Good morning again, Commissioners. So this request, we received some additional funding from the Department of Commerce under the Consolidated Homeless Grant that we were not anticipating. So approximately $340,000 in additional funding that we received. So what we did, rather than issue a brand new RFP or request for proposals, we had issued a request for proposals earlier this spring to receive applications related to consolidated homeless grant programs. So the Regional Housing Council technical team went back and reviewed those previously submitted proposals. We were not able to fund all those applications. So we went back to those applications and are bringing forward recommendations that were approved by the Regional Housing Council to add funding to 3 contracts and to provide 1 new contract. So the Family Support Center of South Sound for an additional $58,000, Catholic Community Services for $40,000, and Ponza for $35,000. Those agencies were all awarded contracts under the original Consolidated Homeless Grant process. However, they did not receive full funding. So this brings those projects to their full funding request. And then a recommendation to provide $207,500 $588 to Olympia Mutual Aid Partners. And that would to allow them to continue their scattered site project in a slightly different vein. But that was not previously awarded under the Consolidated Homeless Grant. With that, I'm happy to answer any questions.
Commissioner Edwards?
I guess, why, we're talking about 4 nonprofits. How come we don't name the nonprofits in here? Is there a reason?
They're listed in the body of the AIS, but I'm, happy to include those if you want to include those in the recommended action. We can amend that to list all 4 nonprofit organizations if you prefer.
I guess what it does is allow those groups the recognition that they're doing good things and we're in turn trying to work with them. I don't know. I don't know what my seatmates might think about that.
I don't have any problem with that.
I
It's
think-
more for me to read, but that's okay.
Just a little bit more.
That's fine, and I guess my question would be about this scattered site. I mean, you said in a slightly different way. Can you elaborate on that? I mean, I know one of the scattered sites is gonna be not a site anymore, based on what Keely said this morning, and the other
Correct.
the other 2 might be going the same way with the right-of-way program, I'm not sure.
Yeah, and so kind of as you indicated, the sites that have been supported in the past may no longer be supported in the future. So OLIMAP will be supporting those at First Christian. There's a tiny home village at First Christian, and also working to more do a mobile scattered site approach. So they'll be continuing to work with folks at Wheeler, but it will be more of a scattered, a mobile outreach approach. And so we're working with them. They also have a contract under the right-of-way, so we'll be able to kind of combine this contract with their right-of-way funding to provide kind of outreach to different encampments throughout the community. So we're working with them to get the specific scope. So there will be some changes in the locations that they serve, but it will be the same type of services they provided, just on a more of a mobile outreach basis.
Okay, thank you, Tom. Let's go to item 6B. I guess that's you again, Tom, so I don't go anywhere. RFP for housing and essential needs and rent assistance providers.
Yes, so asking for your approval to move forward with issuing a request for proposals. And we're actually looking to support 3 different activities or get applications for 3 different types of activities under this request for proposals. And they all have to do with rent assistance. So the first one is around the HEN program. With the lack of renewal of the CAC HEN contract, as we've discussed with you over the last several weeks, we have an interim solution to have some immediate support in providing HEN support to HEN clients, but we're looking for a new permanent provider. And so this request for proposals is to identify a new long-term provider for the housing and essential needs program, with the hope of having someone kind of on board by November or so of this year to take over that program. The other contract that was not renewed by Community Action Council was a rapid rehousing contract with Consolidated Homeless Grant. So we're looking to get applications to find another agency who can implement that rapid rehousing contract. And then third is we have, just looking for here, $2.4 million from the state Department of Commerce to implement a permanent rent assistance program. As the TRAP and ERAP programs expire, that is COVID-specific funding. That is a broad-based rent assistance program. Under the 1277 document recording fee, so this you may recall was a new document recording fee passed 2 years ago, and Commerce is funding a new long-term rent assistance program that will be more targeted and limited in scope. It will be specific to people who are at imminent risk of homelessness, and it comes with case management services. So with the end of the ERAP and TRAP funding, we're looking for a new long-term rent assistance provider. And so this RFP will solicit applications to implement that program as well. So looking for one RFP with applications for those 3 different funding sources. And so I know that's all, there's a lot in there, but happy to answer any questions.
Go ahead, Commissioner.
On your permanent rental assistance program, the Department of Commerce is gonna put $2 million, you said, into it?
Yes, it's $2,471,000.
Is that kind of like seed money until there's ongoing money coming into that fund? Is that what's going on here?
No, that is what we can expect probably on an annual basis to fund this program.
Oh,
So this is
okay.
the first year of funding under the program, but we expect this program to be funded, whether it's annually or kind of with a biennium every 2 years going forward. So the expectation is this will be a new permanent rent assistance program.
From the Department of Commerce?
From the Department of Commerce, correct.
Okay.
So this RFP is asking for one group to have to satisfy these 3 different pieces, or are they 3 different contracts?
There will be 3 separate contracts. Agencies can apply for one or multiple of these pots of
Okay,
money.
so we don't have to have one.
We're not looking for one agency to do all of these activities. We're looking for an agency or a group of agencies could partner together to carry out any one of these programs, but they're not required to do all activities, no.
Okay, that's good. And because it seems like this more targeted, limited approach to this new permanent rent assistance program is going to require a higher level of scrutiny and vetting and sort of just figure out who is, those imminently at risk of losing housing, criteria are going to have to be developed for that, and a very careful assessment of who fits that into that category, because it's not crystal clear, right? It's not like, oh, if you make less than 13,000, you qualify. No, it's like this. Those are words that have subjective meaning. What does imminent mean? What is risk of losing housing? So I would imagine that a pretty robust organization is going to be needed to do that work correctly or thoroughly and properly.
Or it's highly probable that the state will define exactly what that means.
Okay, well, that's good, but it's still someone's going to have to do the work.
Someone is going to have to do the work and follow the rules that are laid out for them to assess eligibility.
Now, on the funding, so you're saying that the 2.4 million that's coming and that probably will be ongoing, that's an estimation of what the 1277 document recording fee is going to generate? And now
that is one component of it, yes.
Because I remember asking you multiple times when that was passed, like, well, what are we allowed to do with that? And you said that, if I remember right, you said there was, a couple of different things, and I think one of them was something like this, rehousing or people at risk of losing housing. But you also said there was sort of further guidance coming from, like, we were kind of in a holding pattern as to exactly what we were going to be. So is this what we're being told we're going to be doing with this new 1277 money?
Yeah, so it has been a little confusing, so I appreciate your patience. And so one aspect, this is one element of the 1277. I believe 60% of the 1277 funds are going into this program. Don't quote that percentage. I may be a little off on that.
What was that percentage?
60% of the 1277 funds are to be used for this rent assistance program. We received 1277 funds kind of about a year ago for some hoteling and additional rapid rehousing. So that makes up all of our 1277 funds for this year. So what I would expect for next year is that there will be a continuation of this rent assistance program, and then there'll be a separate allocation of, based on last year's allocation, 1.6 million or so that will have that broader application of funds. So we're expecting roughly, kind of $4 million, although I will say that document recording fees have taken a substantial decline as interest rates for mortgages increase. There has been a decline in document recording fees. So that exact amount is unknown, but yes, there will be this rent assistance program, and then a separate amount of money for a more discretionary use of 1277 funds going forward in future years, is our expectation.
So the hoteling and rapid rehousing activities that we engaged in this year, there might be discretion to do something else with the 40% if we
Correct.
if the RHC and the Board of County Commissioners decided that.
Correct.
Okay. Okay, well, it's gonna be interesting to see how these different pieces come together, and hopefully we see a really, really tangible result for the community out of these different projects that the state is really helping us put together. But we'll need some time to figure how that looks.
Just quickly, what kind of groups do you expect to respond to this RFP? I mean, is it like, I don't know, Family Support Center or Catholic Services? I'm just trying to figure out which kind of groups you're looking for, or is it just professional companies that only deal in this type of thing?
I think it'll be what we're primarily expecting is local nonprofit agencies like a Family Support Center or a Catholic Community Services or Salvation Army. I would not be surprised if for these programs we see agencies partner together. So we could have one application with, Family Support, an organization or Community Youth Services take one element of this, and then another organization take another element. So I could see a partnership of agencies working together to implement these programs as well. But primarily, I would expect kind of our local nonprofit providers to respond.
Okay, and I do have a follow-up on that. That might be pertinent. All the facts aren't out on our prior problems that, on a relationship.
Our prior provider.
Yes,
Yeah.
on relationships and such.
Right.
So you're gonna go out for an RFP and there's gonna be a lot of people that don't know kind of the behind the scene facts, and
That's true.
when might that information become
We
available?
don't know when that information will
But
be
that could
available,
hinder-
and we can't
I mean, that could
talk about
hinder
it.
applications coming in possibly, is what I'm
It
concerned.
could. Yes, it could.
So how long are you thinking of being locked in if we, on the number of years that you might be asking an outfit? Because once all the information comes out, there's gonna be a different point of view from some groups
Perhaps.
about the county. And
Maybe.
I don't wanna get too carried away on this, but it's crucial to who might apply and how that might in turn serve our public. So, do you see where I'm going with this? I don't wanna be locked into a 5-year thing and a bunch of folks didn't put in because they didn't know all the facts.
Yeah.
Once we get proposals, what is the department contemplating as a length of time for the contracts?
Yeah, so for these funds, contracts will run through June 30th of 2023.
Okay.
So
That's
we'll be issuing, so this is kind of our immediate kind of,
Okay, good, that
effort.
solves it. Good enough.
Okay, thank you,
so there'll be
Tom.
another RFP in the
Yeah,
spring
that's
to
fine.
find for the next year. So.
Thank you.
Okay, let's do our last item here and then we'll take a break. This one's a public works item. It's interlocal agreement for sewer collection and treatment service with Department of Corrections. Joe Plahuta from Senior Water Resources Engineer from Public Works is here.
Yes. Joe, please tell us a little about this item.
All right, thank you, Robin, and good morning, commissioners. So this item update to an existing and now expired agreement, interlocal agreement with, DSHS was who the agreement was originally entered into back in 1999 when the Grand Mound ULID was originally formed. Now the Maple Lane School has come under the ownership of Department of Corrections. So the purpose of this new agreement is to, one, update the parties in the interlocal agreement to reflect new ownership at Maple Lane School, and then also to change the terms of service to reflect how we bill commercial customers in the Grand Mound service area. So the original agreement had terms that weren't carried out in practice, so we're going to be updating that under the new interlocal agreement. with that, I'm available to answer any questions.
Commissioner?
That's pretty minimal information, I think, here. And I'm thinking that that's gonna cause a stir in that particular area if we don't give the public more information. That's all. That's my concern. It's not, it's probably more your concern. So, you know what I'm talking about there? I'm just thinking this is minimal information. And that has been quite a area of concern for that community down there. And I don't want to catch them flat-footed or not inform them about things that are going to happen, might happen, and maybe we don't know, but this is very minimal information that I'm concerned about.
Is there anything new? I mean, besides you said the collection, I mean, we've been providing this service ongoing, even though the agreement expired.
Correct.
So this won't
We've
be
been-
restarting something or initiating something that's not happened continuously over the last years.
Correct. Yeah, this interlocal agreement will just be embodying our current billing practice with Maple Lane School. So we're not changing anything. And I can speak to Commissioner Edwards' question a little bit. The reason this interlocal was originally formed was because Maple Lane School, again under ownership of DSHS at the time, had purchased, forget the exact number, but 200 some odd sewer connections and prepaid for those connections. They haven't used nearly that capacity. So this agreement memorialized that initial purchase of sewer connections. And then as they use that capacity, we track that as we would any other commercial customer. But again, part of the original purpose of the agreement was to track that capacity that Maple Lane School had prepaid for.
So it's reducing, in a sense, kind of because they haven't expanded to their original vision or whatnot?
We're not reducing that allocated capacity, but we are in the beginning of the agreement making reference to it as a recital.
I can only tell you there's going to be a lot of interest in this issue, and if we don't give adequate information, the speculation is always worse about what, got a new corrections facility coming in down there, or it's been a bugaboo to deal with over the years, but most of it has to do with the flow of information that we didn't keep the public informed as well maybe as we should have. So that always brings about concern. They think they're being tricked or something. And I don't think this is
additional information
I
would you
don't-
like, Commissioner?
I don't know.
Should we put out there?
I don't know, but if we move on this, I'm just afraid it might cause concern, and I'd like to make sure that we inform the public as much as we can.
So
that it's not a new project that their DOC's building a
exactly,
new facility or something. I mean, just,
not a new agreement. It's
yeah, I
not
wanna
an
make
expansion
sure
of
we give them adequate
services that they're
information, so
entitled to.
we don't stir things up, that's all. And I don't even know what that would be at this point.
I'm not sure either. I mean, I guess I could think of two wording changes to this action that might help a little. If we added the word move to execute and updated interlocal agreement, and then with Department of Corrections for extending rather than providing, that'll make it clear that it's a continuation of what's gone on before. I don't know, those two things might help
That'll help.
alleviate the concern that we're doing something new here, or there's some expansion that's being promoted or supported by Thurston County, which is not what I'm understanding to be the
Or
case.
change the word from providing to continuing.
Continuing, yeah,
There you go. I think that would help.
continuing, yeah, it's probably better than extending. Yeah, because extending has, I guess, I was talking about extending in time, but you can interpret it as extending in
Exactly.
reach, so good catch.
Okay, that's fine with me.
We'll have next week, but, well, we can always see where Commissioner Mejia feels about that, and we'll discuss it again next week. Okay, this is next week's agenda, and we'll have our standing items under number 8. It's 10:38. We'll take 12 minutes and reconvene at 10:50, and we'll pick up with proclamations and awards. And I've done my self-assessment. We are back. It is 10:52 a.m. Commissioner Mejia, can you hear us okay? I see you on the screen.
Yes, I can hear you.
And I understand you'd like me to keep going, just going through the agendas for you.
Please, sir.
Will do. Okay, very good. So now we've got item 5, proclamations and awards. And look to the clerk of the board.
Good morning, Jamie Caldwell, Clerk of the Board. I have the Farmers Market Draft Proclamation for next week included in your packet for review. I reached out to the Olympia, Tenino, and Yelm Farmers Markets last week as well as this morning to see if there are members of their organization that would be available to attend and accept. For boards and commissions, I've included the reappointment application from Nathan Allen for the Agritourism Advisory Committee. I reached out to the staff contact and verified that the committee is recommending reappointment. Outside of any questions, that's all I have.
Commissioner Edwards, I believe Commissioner Mejia and I looked at this one last week and we were okay. We wanted to give you a chance to look at Mr. Allen. If you need more time, that's fine.
I don't think I need any more time. I think I'm good.
Okay.
On the proclamation for Farmers Market Week, how about, did we get a hold of like the Fair Board about that, or possibly Stephen Brumwell for the University Extension? I'm just wondering, those folks are involved in that kind of stuff, and do they want to participate?
I can definitely reach out and ask. Yeah, I can definitely reach out and ask.
Okay, so we'll follow up on that. Commissioner Mejia, anything on those two items?
No, sir.
Okay, so I guess we can move forward with Mr. Allen's appointment next week or fine. All right, then that will take us to, that covered 5 and 6. Let's take us to PI chapter.
Good morning, Commissioners. Megan Porter, Public Information Supervisor. I do not have any specific updates for you this morning.
Questions for Megan? Commissioner Mejia?
No.
Commissioner Edwards? Okay, thank you.
Thank you.
Then we'll go to briefing or public hearing decisions pending.
None pending?
None pending, okay, very good. Then we've got time for our commissioners' items, and we have quite a few. The first one is Board of Health expansion. Kurt Harden's here. We're gonna have a special meeting today at 4. Jane Futterman's here from Prosecuting Attorney's Office, and Kurt, I'm gonna let you walk us through what, Robin's been involved, I've been involved, to try to get things sorted through. So why don't you kind of walk us through where we're at on this?
Sure. Thank you. Kurt Harden, Interim Director of Thurston County Public Health and Social Services. I'm going to walk through the expanded Board of Health process. And while doing that, there's been some steps that have already happened under the Board of County Commissioners that now has to happen under the Board of Health. I'll explain that. And Jane is here because when you get into WACs and RCWs and different things, it's always helpful to have a lawyer around to at least explain it to you. So, so as I go through, I'm going to share my screen, and I have a presentation that I'm going to go through that will also be the same presentation this afternoon for the Board of Health. So you may see this twice. However, there will be different membership at the Board of Health, and I'll explain that a little bit as well.
So while you're pulling up the presentation, Kurt, I will just preface this by saying that the Board of County Commissioners had been prepared to make appointments of new members to the Board of Health, the expanded Board of Health, today, and that was the discussion last Tuesday. However, after our agenda setting meeting last Tuesday, we were contacted by Jane, who brought some new procedural requirements to light. So what we're sharing with you today with the Board of County Commissioners is the reason that we're not going forward today with the new appointments, and Kurt is going to outline what the process will be and the next steps. So go ahead, take it away.
Okay, thank you, Robin. And Commissioner, I should say that this is informational for the Board of County Commissioners. It will be more than informational for the Board of Health when we get to that point this afternoon. So if you ask questions, please feel free to speak up as we go through this. I would start off by saying that the legislature passed a change to the law in 2021 to expand the Board of Health membership. This went into effect, this new law went into effect on July 1st, 2022. Prior to July 1st, the Board of County Commissioners passed a resolution 16150 in April to address the expanded Board of Health. So as a result of the new law, the RCW that was changed, the WAC that's been implemented, and also the ordinance that the Board of County Commissioners passed in April, these are the steps moving forward. So already talked about the RCW and the WAC. Hopefully you should all have this in your packet. I think these slides went forward. What it now is the Board of Health is now going to consist of 8 members effective July 1st, to include the following. 3 members of the Board of County Commissioners. That's you, Commissioners Mejia, Menser, and Edwards. You were previously on the Board of Health. You remain on the Board of Health as a county commissioner. There will be 1 member who's a city elected official. That person has been selected by the city of Lacey, Councilmember Robin Vasquez from Lacey. She will be at the meeting this afternoon as the newly appointed or newly selected city representative for the Board of Health. There is a tribal representative. This tribal representative is selected by the American Indian Health Commission, and that appointment is forthcoming. And then the next piece is what we're talking about today is 3 healthcare and community members that need to be selected. So the RC.
I want to stop you real quick.
Yes, sir. To
clarify for my seatmates that based on our review with legal counsel and the new laws and administrative code that applies, Robin Vasquez of the city of Lacey is now a member of the Board of Health. So it's no longer just the 3 commissioners starting right now or starting when she was appointed. So we can no longer sort of loosely weave Board of Health business into Board of County Commissioners business, for example, in agenda settings. If we're discussing matters as the Board of Health, we have to make sure Robin's included, council member, and and then we're going to be adding, we may at any point get a tribal appointee, and we're going to talk about the other 3. But I just wanted to lay that out for folks that business is going to have to change in its process starting right now, and that's why we're doing things a little different. We didn't review the Board of Health agenda together because we're not the Board of Health anymore by ourselves. So we're going to be doing things different.
So that might change the way we even interact, I suppose, when we get more than 5. So that, for an example, I can say to you, well, what time's that Board of Health meeting or whatever, and be legal.
Under the quorum of the Board of Health.
Yeah, the quorum changes. So is that correct as well?
Yes, and that is one of the things that Jane talked about. Once you hit,
5.
I think now with 4, and I'm gonna turn to Jane. Now that there are 4 members of the Board of Health, is 3 a quorum or is 2?
You're correct that 3 would be a quorum if you have 4 members, because you need to have a majority present.
Commissioner Edwards and I could discuss a Board of Health issue and not violate the Open Public Meetings Act.
That would be correct, because in the ordinance, as you adopted, you established that a quorum would be in the majority of the members holding positions on the Board of Health, not including the vacancies. So as of July 1st, there are 8 positions on the Board of Health, being the 3 county commissioners, 3 community members yet to be appointed, the city member who is Councilmember Vasquez, and then the tribal representative yet to be appointed. So currently there are the 4 that are filled, and a quorum is the majority of those. So you're correct, that would be 3, and which means that 2 members can have an interaction without violating the Open Public Meetings Act.
And I understand that, but I'm going to ask one more question just to be, there are situations where under this legal context, it's okay, but there's an overlapping legal context that doesn't allow it, so if Commissioner Edwards and I are speaking about a Board of Health item of business, that is not considered county business vis-a-vis the Board of County Commissioners?
So I guess I'd avoid the term county business because so many things are county business that are handled by other boards and other entities and other decision makers. So I think in your mind, as you're sitting on multiple boards, think of the Board of Health business being under the Board of Health, and you apply rules to that. If you're, for example, a member that serves on one of those other community boards that are intergovernmental boards, like the Capcom or whatever the other boards you're on, you follow the rules of that board. And so with the county commissioners, yes, it is the legislative umbrella for the county, but you only need to comply with that quorum requirement of not talking to one other member, because 2 is a quorum, when it applies to matters that are within the purview of the county commissioner's business. And so think of it as Board of Health business and Board of County Commissioners business. So yes, you can talk to another Board of Health member about Board of Health matters without violating some rule for the Board of County Commissioners, as long as it's not something that also needs to come before the Board of County Commissioners.
Right, I mean, to give your example, I mean, like if I don't talk about lot business with Commissioner Edwards or Mejia, because even though it's something that they don't have a vote on that, ultimately those issues can always filter back to the, if Commissioner Edwards is really upset about what Lot's doing, he could bring up to the Board of County Commissioners, I don't want to be in Lot anymore, or I want to send a letter to Lot saying, I like what you're doing. And that overlap has always been too murky and dangerous for me to even think about, riding any kind of, close edge. So to me, the Board of Health, kind of the same thing in a way. I mean, it's very overlapping with the work we do as county commissioners. County commissioners can certainly get involved in some way. It's part of our jobs as commissioners to be serving on the Board of Health. And I would need absolute certainty from you that there is a clear line there that we could follow and be safe.
Right. And yes, and I encourage you to be cautious with this. And a good example is appointments to the Board of Health. It's the Board of Health that reviews the applications of these community members that you'll be talking about today and interviews them and goes through a selection process. But once the Board of Health has determined who should be selected, they refer that selection to the Board of County Commissioners for the Board of County Commissioners to make the ultimate appointments. And so it is a matter that will come before both boards. And so for that reason, I'd encourage you to be cautious and not confer between county commissioners on that selection of the additional members to the Board of Health. And so I agree with you. I think you need to be very cautious because so many matters come before the Board of County Commissioners. But ultimately they are separate boards. And so if there are matters that are not going to be before the county commissioners and only Board of Health matters, then you need to follow Open Public Meetings Act rules, but the Open Public Meetings Act would allow you to discuss with other county commissioners or other Board of Health members, excuse me, as long as there's no quorum. And we should talk more about that in the future with the Board of Health, because then there are the other issues for Open Public Meetings Act, which is you want to avoid anything that could be a serial discussion where you talk to one member and then another member, and then it could inadvertently become you've had some kind of discussion that could be perceived as agreement among a quorum. So you certainly want to be cautious going forward. I'll just leave it at that.
Okay, very good. Let's keep going then. Thank you.
So for recruitment, these are the steps the Board of Health must take. Actively recruit applicants for the healthcare and community member positions. It has to be done in a manner that solicits a broad pool of applicants that represent a diversity of expertise and lived experience. What I will like to say to this point also is that what the Board of County Commissioners did prior to July 1st for recruitment was beneficial because it got the word out there. We were able to advertise the fact that we were expanding the Board of Health. So all of the Board of County Commissioners actions prior to July 1st can be incorporated in what we're doing now as part of the messaging that we are doing, that took place. However, as of July 1st, it now must be the Board of Health doing these steps. We need also, the Board of Health has to provide reasonable advance notice for applicants to apply for vacancies. Also post a vacancy announcement in public places, in the newspaper of record, in all geographic regions represented by the Board of Health, and making sure the vacancy announcement is available in any language upon request, and then work with the local community organizations to distribute the vacancy notices. The process that needs to happen is all applicants for the non-elected positions shall be interviewed in a panel format by the Board of Health, but in the event of a substantial number of applicants, the Board of Health may elect to interview a smaller number of applicants, as long as those interviewed include a diversity of experience and lived experience. So what that means is if the number of applicants is a large number and it's not feasible to interview every one applicant, then the Board of Health can narrow that down based on your criteria that you establish unto just a useful number that you can accomplish. And then the interview shall consist of a standard set of questions and may include follow-up questions if necessary to understand the response to a standard question. In other words, just like any other interview process, from an interview panel, you'll have questions in front of you at the beginning that you'll determine, and then turn around and ask all the interview panel members those same questions. The Board of Health shall refer the selection to the clerk of the Board of County Commissioners for consideration of appointment. The referral shall include the selected applicant's completed application and cover letter of interest. In other words, the Board of Health refers their nominations for the Board of Health over to the clerk of the board for the county commissioners, and then the Board of County Commissioners shall be approved and appointed by a majority vote of the Board of County Commissioners. So the health care and community members, those three positions that we're going to discuss here in a moment. So for the selection and appointment, the Board of Health shall assess the following when considering applicants: service, current or past, on other local boards or commissions, whether the applicant's background meets the criteria of the healthcare and community member category for the position on the Board of Health, potential conflicts of interest, demonstrated commitment to public health, whether the applicant represents a diversity of expertise and lived experience, whether the applicant represents the geographic diversity of the community, and also when considering applicants representing the category of consumers of public health, whether the applicant identifies with a historically underrepresented community. So my recommendation to the Board of Health this afternoon will be to, as part of the application process, submit or ask applicants to submit a supplemental questionnaire with these questions on them that allows the applicants to delineate, to spell out their service, what their background and how it meets these criteria, so that it makes it easier for the Board of Health to look at each applicant to determine how they fit into these categories.
I'll just say real quick right here that for my seatmates that this is informational for the Board of County Commissioners as to what's going on, why we're having this special meeting. If there's, and I will open it up for questions, but if there's any debate or discussion or concerns about this process, we'll need to take that up this afternoon at the Board of Health meeting with the full Board of Health. So keep your questions just to kind of, what Kurt's talking about, just an understanding of why we're having today's special meeting at 4. Go ahead, Kurt.
Okay, and I, Commissioner Menzer, I saw Commissioner Mejia had her hand up. I didn't know.
Okay, great. I can't see that because of the way of our screen is. So go ahead, Commissioner Mejia.
Nope, you basically just addressed my question. I'll save my questions for this afternoon.
Perfect, thank you.
Okay, thank you. So criteria for non-elected Board of Health members: all members of the Board of Health must be Thurston County residents. That's stipulated in the ordinance. Healthcare and community members cannot be elected officials. The tribal representative, that's already selected by the American Indian Health Commission. And then 3 members are approved and appointed by the majority vote of the Board of County Commissioners. These are the 3 different categories: a member representing public health, healthcare facilities and providers, a member representing consumers of public health, and then a member representing other community stakeholders. This first category, this is the criteria for the first category. And while This may be, the Board of County Commissioners may have discussed this in a number of meetings prior to July 1st. We have to keep in mind that we're going to have new members of the Board of Health, especially starting this afternoon. So this is also informational for them. The first category, this member must be a person practicing or employed in the county from any of the following categories. Medical ethicist, epidemiologist, experienced in environmental public health or the equivalent, community health workers, holders of master's degrees or higher in public health or the equivalent, employees of a hospital located in the county. And then this is the last category, last bullet of this category, and of the following providers holding an active or retired license in good standing under Title 18 RCW, physicians or osteopathic physicians, advanced registered nurse practitioners, physician assistants or osteopathic physician assistants, registered nurses, dentists, naturopaths, and pharmacists. So those are the criteria for category 1. Category 2, a member representing consumers of public health. This category consists of county residents who have self-identified as having faced significant health inequities or as having lived experiences with public health related programs, such as special supplemental nutritional program for women, infants, and children, the supplemental nutrition program, home visiting, or treatment services. Individuals from historically marginalized and underrepresented communities will be given preference. These individuals may not be elected officials and may not have any fiduciary obligation to a health facility or other health agency and may not have a material financial interest in the rendering of health services. And in the third category, a member representing other community stakeholders. This category consists of persons representing the following types of organizations located in the county. Community-based organizations or nonprofits that work with populations experiencing health inequities in the county. Active, reserve, or retired armed services members, the business community, and the environmental public health regulated community. So this afternoon, the proposal that I'm presenting and laying out for the Board of Health to consider is tomorrow, August 3rd, reissue the recruitment with expanded outreach and a goal of attracting additional applicants using the reformatted application. In other words, same application, but a supplemental questionnaire that goes with that application that addresses those criteria that were previously mentioned. On August 19th, that recruitment closes at noon for the applications that are received to the Board of Health members by the end of that day. Proposing on August 24th to schedule a special Board of Health meeting to consider which applicants are selected for a panel interview. And then proposing on August 29th to schedule an interview panel. And then the Board of Health formally recommends final selections to the Board of County Commissioners for appointment. And then when I say those are proposed, it's going to depend obviously on the Board of Health wanting to adopt this as the next steps, but also their availability on these proposed dates. And how that's all going to work out. One of the criteria is the panel interviews have to be done in public and as an open meeting and as a special meeting of the Board of Health. And I don't know, Jane, if you want to talk a little bit more about that.
I guess I'm happy to answer any questions. I'm not sure.
Yeah, let's just do that. Commissioner Edwards, questions for Jane or Kurt?
The only question I have right now is the clerk of the board for the Board of Health was determined a couple of years ago to be consolidated with the Board of County Commissioners for whatever reason. That was before this legislation was ever proposed. I'm wondering if there is anything in here that it might be like a unfunded mandate to hire a clerk of the Board of Health. Nothing detrimental about Jamie and doing the job. I am worried about the overload of work that might be affiliated with this new adventure we're embarking on. So I don't know. I never did see anything in here that reflected any of the administrative activities that might take place with this new board. So did I miss something, or is that just something that was never addressed, or we're just supposed to make Jamie work 16 hours a day, or what are we gonna do here?
Well, first of all, Commissioner, I was going to say there's 24 hours in a day, so Jamie could technically work 24 hours in a day. But no, we discussed that, and I think the decision, not the decision, we're going to let the, once all the Board of Health positions are filled, then that needs to be determined by the administrative process needs to be determined by the Board of Health once they're filled. However, you know, the Board of Health is meeting this afternoon. The guidance that you can give to staff is up to the Board of Health, but we're deferring that to the full Board of Health down the road for some of that administrative pieces. I will tell you internally, I've been working with staff to come up with some potential recommendations on how to address that issue. And so we are working that. We are coming up with some recommendations, but we wanted to get through the process for selecting all the members of the Board of Health.
Okay. I mean, I totally agree that, you know, we can deal with that later, but I kind of agree with Commissioner Edwards, and I'm kind of confused that the Board of Health doesn't know what the clerk, like what Jamie's workload is. The Board of Health doesn't do budget decisions on if we need new staffing. I mean, that has to fall under the Board of County Commissioners to deal with the administrative support for the Board of Health, right? I'm looking at Robin.
So you know, not being intimately familiar with the new legislation around the Board of Health, I believe that matters of budget, fees, money are still to be determined by elected officials, which would be the Board of County Commissioner, on how we execute funding that is in your.
And the Board of Health maybe can make a recommendation on what they think the needs are, you know. We need a 0.75 FTE for this, and then we decide how we're gonna pay for that, or who's gonna do that work, or.
But the Board of County Commissioners for county employees, it's your prerogative to establish FTEs, set compensation, pass a budget. That is all under the purview of the Board of County
Position
Commissioners.
control, right? Like what Jamie's description, job description reads.
So I don't see that changing, and I'm looking to Jane to tell me if I might be off base here.
And Jane, we don't need an answer on this today, but I'm glad that this has been raised, because maybe it's something you can chew on over the next month.
I think that there is some staffing information in the new law, but I'm not sure exactly how that's gonna fall.
So I can answer portions of your question, and obviously more detail to come. But first, on the budgetary decisions, this law did not change anything, didn't address anything related to budget or staffing, really. The law has been and did not change that the Board of Health may appoint an administrative officer to oversee the administrative matters of the Board of Health. And my understanding is you do not currently have anyone appointed as the administrative officer because you have interim and acting public health directors. However, previously, the director of public health, when you had a regular appointment to that, the director of the department was appointed by the Board of Health to be the administrative officer. And there's some statutory provisions related to that. So without getting into the details, since I don't have that in front of me at this point, my understanding is you have not currently appointed someone to that position. The other thing so a couple of things, the clerk position. So for the Board of County Commissioners, there is a statute in state law that addresses the Board of County Commissioners appointing a clerk of the Board of County Commissioners. There is no similar such provision in state law regarding the Board of Health. So much like many of our other boards, certainly the Board of Health is a county board, and you'll need staff to staff that board prepare agenda items and notices and all those kinds of things. And so it is up to the county and under the auspices of the Board of County Commissioners to fund and provide staffing for the functions of the Board of Health. However, it doesn't have to be designated as a clerk of the Board of Health. It could be a staff appointment. You'll have to determine what's appropriate there and where that function should reside. And, I would assume either under county commissioners or public health under the department, but that's really something for the Board of County Commissioners to determine. And then the last thing is regarding restrictions on who can make decisions on the Board of Health on financial matters. Robin, you are correct that there is a line in the new law, but it only relates to setting or modification of fees for permits, licensing, and applications. So when the Board of Health has a decision to make on establishing permit fees, licensing, or application fees, think of the things that are under the county sanitary code, like septic permits and wells and those kinds of things. Right. Those decisions are only to be determined by the elected officials on the Board of Health, the city and county elected officials. Those other members do not participate in decision-making on those fees. And with that, if I need to clarify anything, if you have questions, I'd be happy to answer.
I'm going to ask, Commissioner Mejia has her hand up. Go ahead.
Thank you. I guess my question is, I'm still trying to understand on kind of why we hadn't discussed this before or gone over this before, and why is it now, I guess.
So I'm gonna jump in here, Commissioner. I don't think that we have a clear answer to why you have not heard this process before today. So that's really nothing that staff can respond to at this point, but I can say that now that we are very aware of what's in the WACs, and the WACs are relatively new, we know that we need to follow this process.
So this is because I knew that we were waiting on clarification, right?
Right.
So this change is due to the new WACs that have come out, and that's why we kind of have to pivot from there.
These are clarifications in the new WACs, yes.
Yeah, I would say we should have seen these a little earlier, but they are new. I mean, there was going to be that shift. They've shifted several requirements, made them more specific, requiring panel interviews, requiring the Board of Health to do this work rather than the county commissioners. So there were some pretty significant changes. It would have been nice if we'd caught it about a month earlier, but we are where we are, and we're trying to get this sorted through.
Okay.
And I'm going to ask commissioners to just defer any more discussion on this for this afternoon's meeting when we have a full Board of Health, because we have several things to do. Next is a sheriff's item regarding an letter of support. And I see Under Sheriff Brady's here.
Yes, thank you. And thank you to Jane and Kurt for joining us this morning. We'll see you later today. So the sheriff's office has submitted, they would like to, under one of the new laws, send I'm not sure if it's one or two of our deputies, to be trainers and attend the training that's offered by the Washington State Criminal Justice Training Commission. And it requires a letter that is signed by the top executive in the county, and that would be the Board of County Commissioners. So I'm going to ask Ray to explain a bit more about the training, and then I'm going to ask the board's approval for this letter.
Yeah, good morning again. Last year, a law was passed, Senate Bill 5066, that required training for duty to intervene for law enforcement officers. CJTC came up with a model for that. They chose to select a program called ABLE. It's the ABLE project, which stands for Active Bystandership for Law Enforcement. It's run by Georgetown Law Library through Georgetown University. In order to be part of that program, it requires a strong level of commitment, both from the sheriff's office, from the community, and also from our county leaders. And so we've chosen that we would like to be part of that project to do that. What that requires from the commission is obviously this letter of support. If we're selected to be able to be part of this project through Georgetown, we will then send 2 of our deputies to get, it's a 20-hour training. It's a train the trainer training, so they'll get 20 hours of training. And then our plan is to have them come back and train our entire commission staff on this, which is an 8-hour required initial training, and then a 2-hour ongoing refresher annually that will occur. This has to be done. So there will be teaching this to the academy. I believe that's already in place. But anyone that was hired or commissioned prior to January 31st, I believe, of this year, is required to complete this training by the end of next year. So the December 31st of 2023. So our plan is if we are selected for this program, that we have it built into our in-service training for next year. So all of our deputies will be able to get that training. Be happy to answer any questions related to that. But again, the project falls around training for a duty to intervene. So a requirement by law that our deputies actually complete a report if they witness some act of wrongdoing by one of their fellow deputies or even an officer from another agency.
Commissioner Mejia, any questions for Undersheriff?
Yes, Under Sheriff Brady. No, I think it's great, but I have a question about the cost and ongoing cost of this. And if you could kind of walk us through that.
Yeah, so the partnership that was created from Georgetown and through CJTC is free. So the training to our initial instructors is free. As I mentioned, we plan on building this into our in-service training days. And so those generally occur on our overlap days. So when our 2 separate teams overlap, one team trains and one team covers the staffing for the road. So when we do training during those days, it obviously there's the cost of the employee for that day, but it's covered under their regular salary. So this program should not cost us any cost.
Anything else, Commissioner Mejia?
No, sir. Thank you.
Okay, Commissioner Edwards.
Do they have to go to Georgetown for the initial training of train the trainer?
No, I don't know specifically. I can check. I believe it's held at the academy at CJTC. I don't think this is an online training. So I think they go to a class at CJTC, but it is possibly an online. But no, they do not have to go to Georgetown for the training.
And this kind of is a byproduct of officers that have, I guess, chosen not to intervene when a bad thing is going on. Is that basically what we're doing here?
Yeah, absolutely. I think there's been a few instances, across the nation where, officers have made a poor decision in not intervening on something. So the legislature, stepped in and said, we're gonna create formalities that say this is what you shall do, and if you don't, there are going to be significant consequences to that. So I think overall this is a good thing for our department, for all of law enforcement. We expect all of our employees that if they see wrongdoing, that they're gonna do the right thing. They're gonna try to stop that. They're going to report it, And then, the full support from the sheriff's office as far as investigating those kind of allegations.
I guess the only other thing I'd say is bystandership. Is that some new word or something that they've come up with to cover what this has to do with? It's kind of different. Anyway, no, I'm fine.
It was definitely a new word to me. I hadn't seen it before, but when you talk about a duty to intervene, it does make sense.
Commissioner Mejia, your virtual thumb is up? Or not?
I'm sorry, I don't know how I did that.
No, I'm just teasing. I'm teasing. We got 2 thumbs up in the boardroom.
Oh.
I'm wondering if you're thumbs up on this.
Yes.
Okay, very
We'll
good.
get this letter circulated for your signature. Thank you, Under Sheriff Brady, for hanging out with us this morning.
Yeah, thanks for having me. I appreciate it. Thank you.
Thank you. Next item is under 9.3, Creek renaming request.
Yes, so the Commissioner Mejia received this letter from, actually part of an email, from the U.S. Board on Geographic Names. And the U.S., I think I'm gonna call them the USGN, has received a request to rename a lake that is here in Thurston County. And part of their process is to ask the governing body of the local jurisdiction their opinion on the rename. Now, you'll see that the proposal is to rename Lake Lucinda, or rather,
No, it's a creek.
yeah, the creek that goes to Lake Lucinda, to name the creek Moonlight Creek. The Washington State Committee on Geographic Names has determined that they do not support this proposal, but they still would like to hear
Who
from
doesn't?
the Board of County Commissioners.
Who did you say
Let's
doesn't
see.
support?
I believe that I read that they do not
I see
support
that,
the
it's on page
proposal.
2, the proponent, we will process the proposal even though the state does not recommend approval.
Right, the state does not recommend, and I believe it's the Washington State Committee on Geographic Names.
Okay.
So they voted to deny the proposal for further consideration. However, they are following their process, reaching out to the Board of County Commissioners to hear your opinion on the proposal. Now, the person that did the proposal, I believe it's Chandra Brady, although I guess I'm hesitating because she has included a title here. But her proposal, she is saying to the board that there are no other homes on the creek and that this request is coming from her family. And she is requesting that the board have a favorable consideration of this request. So it's really up to the Board of County Commissioners whether or not you would like to respond to the U.S. Board on Geographic Names and what your response would be.
Just looking at this, the board, the argument for it is on kind of, it's not numbered, it's 3 pages from the back. And then page 2 is the argument against by the State Committee on Geographic Names. Can I just read that as the chair, just so we're all on the same page? I don't know if my seatmates had a chance to read through this carefully. So the request says that the creek starts at the north end of Lake Lucinda, travels 0.56 miles before ending. It is not formally named. During the day, the creek lies under foliage and is almost invisible. At night, the moon reflects off the creek and is referred to as Moonlight Creek. The creek forms two sides of my family home's property line. I've lived in the home 2.5 years, and the creek has been known as the Moonlight Creek during that time. Locally in the neighborhood, the kids call it Moonlight Creek. This does not require a name change because it is currently unnamed. And then the state committee says that they voted to deny it, stating that the stream was rather short, although there's no restriction against naming small streams. They're uncertain about the nature of the stream below Lake Lucinda, and confusion about how the stream could reflect moonlight at night, yet be almost invisible under foliage during the day. Presumably, the stream reflects dark foliage during the day, among other reasons. So that's what I saw as kind of the pros and cons that were argued.
Whose district is this in?
That'd be mine, because it's Delphi, yeah.
Yeah, okay. I guess I'm gonna wait for a recommendation from
Commissioner
my
Mejia,
seatmate.
do you have any,
Well,
let me just ask
Well-
procedurally, what do we don't decide this, we just say whether we support it, and then it
Yes.
goes to who? Back to the,
It goes back to the US Board on Geographic Names.
okay, Commissioner Mejia.
well, when I read the letter from the state, right, or from them, on why they denied it, I don't know, I felt like there wasn't really something really concrete, because, like you mentioned before, the BGN has no restrictions against naming small streams. So for me, it's like, I don't see why not, is my, if there's really no restrictions about naming small creeks, and nothing there, in their letter showed concrete areas on why not to name it, then for me it's why not?
I tend to agree, I mean, it's kind of it's not been named, so what's the harm? There's not been it's on a essentially private property. Sounds like a good name. I don't know. I mean, I don't have a problem with the Board of County Commissioners. If we direct the county manager to respond and say that the board supports the requested name change.
Sure, and
Just
that's
as simple
all.
as that.
Is this an intermittent creek or a permanent creek?
Small creek.
Well, it says it's a tributary of Darlin Creek.
Right, but I can think of a lot of places that have creeks that are intermittent creeks.
Dry up, yeah.
Yeah, and
dry
then
up.
in the summer, there's no creek.
It says it averages about 5 to 6 feet in width, so that's pretty substantial.
If it's flowing hard,
Yeah.
yeah. I don't, not that it's an issue for me, I'm with you guys, it doesn't matter to me. On these kind of things, with no review in the background, I mean, if it is all on one property, it doesn't affect anything else, but about the time we take a position, and then the old family from up the road go, hey, that's always been Jones Creek, or whatever. I hate to jump on it immediately, but it's not an issue to me. I'm not gonna break my pick on one way or the other.
Well, they've
I'm
actually,
gonna go with my seatmate.
they've actually included a form. All we have to do is just check a box that we recommend approval. And given that it's unnamed, I mean, if someone really had a personal stake in this, they would have gone through this process in the past. So that gives it latitude. I think a change would be, if they were asking for a change, then I would agree with Commissioner Edwards and I'd say, let's slow this down, check with the neighboring properties or something like that.
So this is DNR property, basically, though?
No.
It's private.
The whole thing is on private?
That's what she says in her initial email, I believe. It's a small creek behind my home. Okay, I guess there's no other homes. I guess she doesn't say that it's.
I just
There's
wonder,
nothing about ownership.
it's mostly DNR property up there, I odd.
It is, yeah, because I've been working with residents on some of the cuts right above those neighborhoods.
Yeah, so I don't know. I mean, what, you know, the DNR, they don't have a name for it. You know, a lot of times they do.
I'm sure that this department would
Would know.
reach out if they were,
I got no heartburn if that's what you're asking. That's for sure.
Okay, well, sounds like the board is authorizing recommendation of approval, send it in.
great, that we
Let Ms.
support the
Brady know.
name change, simply. All
Let's
right,
just make that simple.
cool.
Thank you. Commissioners, let's go to item 4, which is the Racial Equity Council applications. And here's Nicole Miller, our Racial Equity Program Manager, to go through this issue with us. Hopefully there's no new wax telling us we made this up ourselves. So.
No, yeah, this was a council that we created, so I don't think there's any new wax. So good morning, commissioners. I'm excited to be here for a follow-up on the Thurston County Council on Racial Equity and Inclusion. So if you recall, I presented last week and we had a pool of 12 applicants. We talked about them, and then I just want to anchor for everybody just a few things that we had really wanted this council to focus on and to be comprised of. And so the number one is we wanted this council to be a minimum of 50% community members from unincorporated Thurston County, so outside of the city municipalities. We also wanted broad representation from the BIPOC community members who have lived expertise in systems of care that marginalize and oppress communities of color. And we wanted community members whose voices may not necessarily be elevated in the community currently. So people maybe who were not already serving on some boards and commissions and things like that. We also are seeking council members whose employment or who provides us with a diverse perspective as well. And of course, we don't want the entire council to be made up of diversity, equity, inclusion, and belonging specialists. So really just trying to balance people's employments and their lived expertise, their current contributions in the community, so that we can have a broad perspective of new voices that are elevated to the table. We also want people who with experience in changing policy and practice and organizational culture within spaces like county governments or organizations. So just in being cognizant of balancing all of these attributes and characteristics and things that people bring to the table. Last week I did a deeper dive with Commissioner Mejia, also with Commissioner Menzer separately, did that deep dive and looked into the applications, and then had an opportunity also to have a conversation with Commissioner Alexander this morning. And we, in these deep dives, really looked at, again, the resolution and wanted to focus on the original intent of the resolution, which was to stand up that seven founding members and then have that those 7 folks work to grow that council to 15 over the next 3 years, really being cognizant again of any missing or intersecting identities that are not represented at the table. So having said all of that, and again, also I spoke briefly with the county manager before he went on vacation. I am suggesting that we identify or appoint these 7. You have the 7 that are presented to you. There are not names currently on those. I can say their names whenever we're ready to do that. But my suggestion is we appoint the 7 that I've presented to you. The first 4 that are in green, those are all folks from unincorporated Thurston County. And so that's more than our 50% minimum of representatives from unincorporated Thurston County. I know it says Olympia, but I looked up everybody on the geo data, whatever it's called, and the number 1 through 4 live in unincorporated. And then again, you can see that we've got a representative who lives in Olympia, one who resides in Tumwater, and then also in Lacey. I just think that the unique makeup of the people's lived expertise and current employment and then relationship to the community, I just think this is going to be a really solid council. So encouraging you all to make a decision. I didn't know how to wrap that up. Sorry. I'm going to pause now for you all to speak.
Yeah, okay, Commissioner Mejia?
Well, I think the recommendations that Nicole brought are good, and I'm in agreement with them.
Okay. Commissioner Edwards? Thumbs up for me too, after our discussion and understanding of why we're gonna start with the 7. I'm comfortable with what you've laid out, so I think we should just start here and then the committee can build its own character based on gaps as they get going. So that's,
Excellent.
I think that makes a lot of sense. So how would we go about then doing this? Putting it on, does it have to go on to a Tuesday afternoon? Clerk of the board said, think so.
I think that we would need to go to an AIS so that
For
you
next
can appoint
Tuesday,
these
maybe, or-
members. Could we have that ready for next
On the 9th?
Tuesday?
I could have that ready at 2:00 today if you want. I can also have it ready on the 9th, whichever you prefer. Like, I'm ready to rock and roll whenever.
Okay,
The 9th could
let's
be
do the
great.
9th.
Yeah.
And will they be consent items, agenda? Just
Yes,
Okay.
like your normal.
Okay, very good. If that's okay with the commission, we'll just move this forward.
Can I ask a follow-up question?
Yeah.
Should I, ahead of the August 9th meeting, should I reach out to these folks and let them know that this has been decided, or should it be a surprise on the 9th? This is
I
my
would reach
first.
out ahead.
Reach out ahead, okay.
I think
But
we
your
reach out
appoint-
ahead when
I mean,
we're
just
appointing people.
stating the facts, which is your appointment has been placed on the commissioner's consent agenda. You can't, assure that somebody won't change their mind before that and ask for it to be, but that's a fact that those items have been moved forward and expected to be approved off the 9th.
And if folks ask if they can be here in person, what would the answer be to that?
Absolutely.
Okay, and then if I could just take 30 more seconds of your time, I have an update just related a little bit to the council. I just wanted to give you news that we are almost ready to launch the countywide racial equity and inclusion employee survey, the anonymous survey. I'm just in the process of getting that survey built with GARE, which is the Government Alliance on Racial Equity. This is a free survey that we're doing. It's the first of its kind, just to see where all the individual departments are and sort of their racial equity journey. And the results of this survey will be provided to us in the fall, and then we can use those results of the survey to build a very unique and individualized racial equity action plan for the county based on the results of that survey. And so I think the survey will be really important for us to also present to the council, that they can get into that survey and kind of dig in on what they want to focus and work on. So it's just really exciting information for us to have a starting point. So just excited to let you all know that that's happening soon.
Perfect, thank you. Any questions on that? Go ahead,
Is
Commissioner.
the survey going out after we create this body, or is it going out before we create the body?
I think the survey, the timing of the survey is going to be after you create the council.
Yeah, so they can have some input.
Yep. And the survey is for county employees.
Commissioner Mejia, anything there before we move on?
No, sir. Thank you.
Very good, let's go to item 5. Thank you, Nicole. Commercial Aviation Coordinating Commission. And Commissioner Edwards, I brought this up as a commissioner item last week. We had noticed that after our opposition to this, we were included on the list again. We weren't sure how, why, or where, but there was an open for public comment. So I asked, or Commissioner Mejia and I asked for some follow-up from the Assistant County Manager to potentially prepare a letter for us to restate our opposition.
Right, and so I want to thank staff who prepared this letter, did a little bit of research. Found the email where the board was indeed notified on July 10th of 2020 that Thurston County was being removed from consideration. So here we are, we're not quite sure how we got back on the list, but this letter is ready for your review and for us to send, letting the commission know that the Thurston County is not interested in having an airport.
Do we make reference in the letter that we were notified in 2020 that we were not on? You say you,
Yep,
okay.
it's in your packet
I
and that is
Thought I
referenced.
saw it, but I misplaced it. So yeah, I'm good.
Okay, I've looked at this letter. Commissioner Mejia, any edits or more time needed, or are you supporting?
Yeah, no, I looked through the letter. I think it looks fine.
Great.
Okay,
So
3 thumbs up there.
we will get this passed around for your signature, and we will let the constituent who has been reaching out to the board regarding this subject know that the board is sending a letter.
Okay. Next item is Sea Level Rise Committee. This came up last week, Commissioner Edwards. We discussed that the Sea Level Rise Committee, which includes Olympia, Tumwater, and the Port, and the Squaxin Island Tribe, asked if the county would like to be an ex officio member to just kind of track what they do. They meet quarterly. Commissioner, I was willing to take up kind of connects to stuff I do with the Climate Committee. If you're amenable to the county having that role, okay. And then there's a meeting August 5th. I actually ran into the chair, Danny Madrone, and I let her know that I was not available. Commissioner Mejia might be, but she said there's nothing. Commissioner Mejia, if you would like to attend in my stead on August 5th, you may. I won't be available, but you certainly don't need to. And we can take this up at the next meeting in November unless you're interested in going. So it's up to you, really. But I would like to send a letter back to the committees, just accepting that seat.
Are these all elected officials on this?
Yeah, Bob Isle, Danny Madrone, Leanna Dahlhoff, and then Chris Peters of the Squaxin Island chair. Is that something we can put on Ramirez's plate, or Robin?
To accept
Just
the appointment.
Just
yeah,
a quick
we can
response
do
letter
that.
saying we will make sure we're in attendance at the November meeting.
Yeah, we
All
can
right.
do that. We apparently lost Commissioner Mejia.
Okay. Well, that was it. I did have a commissioner item or two myself. We have a few minutes. Let's see if Commissioner Mejia will come back. Do you have a commissioner item?
I do have a couple.
Okay.
Yeah.
Well, then let's just, let's go then. Go ahead, Commissioner Edwards. Let's start with yours.
Well, this depends on if my seatmates have read Mr. Pettit's communication from this morning.
No.
And I can't ask Commissioner Mejia because she's not there anymore, so I guess more to come.
She was dealing with a family issue this morning, so I doubt she was working on Mr. Pettit's email.
Okay, well, I guess I'd just say he's making some pretty serious accusations, and I know we've discussed nuisance or whatever, and I know we end up in a situation, when I say we, as elected officials, pretty much anybody can say anything about elected officials, but staff, well, I just wonder, is there litigation, that could be brought? I don't know, just something to think about, if things aren't true. But if they're true, then what about that too? So,
Right.
okay, so I'll just let it go at that, because I'd like to have, you gotta be aware.
More
of what-
informed discussion
Yeah,
on it.
right,
Okay.
so no one can say it anymore at this point.
Okay, I'm gonna do a quick one. I have two, and one of them's quicker than the other, so I'll raise that now while we're still missing Commissioner Mejia. And that is just that. Should I get it right? No, it's not showing me. Oh, I remember. It's about next Wednesday, we have a meeting with DNR about Summit Lake. And all I know about that is, I think what county manager told me, because they didn't come to me to set that up. They went through the, county manager or whoever, Katie or whoever. So what I thought I understood is that they're gonna have a high, and this is a Zoom meeting, I guess, but they're gonna have like some hydrogeologists to kind of explain to us why they don't think our concerns are really valid.
Regarding the timber sale.
About the
Timber
logging.
cuts in Summit
Yes.
Lake and how it's gonna affect the thing. I don't wanna be caught flat-footed there. I did touch base, when I first heard about this, which was maybe 6 weeks ago or a month ago, I did touch base with Kevin Hansen, who is the person that did the report for that supported our letter. I let him know that this is what I expected or what I was hearing, and would he be available to, give his counter perspective if we don't agree with what we're hearing, and he said absolutely. But since then, I haven't reconnected with him or talked to Ramiro. I wanna make sure that we have the right staff in place to be able to have a robust discussion. Sounds like it's almost gonna be like a battle of experts or something here. I don't know. I mean, I'm not an expert in the issues that are involved. I relied on staff input. But I just wanted to raise this so that we could reach out to Kevin or whoever his, Josh. I mean, I'm not sure who needs to be kind of looped in and ready for what we think needs to be discussed with DNR on the 10th. Because if it's just a hydrogeologist telling Commissioner Edwards and me and I a bunch of stuff that we barely understand, and we don't have the ammunition to respond, it's not going to be that productive. And I know that our staff.
When is this taking place?
A week from tomorrow.
Wednesday, August
So,
10th.
so that's just that was just my thing there. Back to you.
Well, on that particular issue, I would say that those photographs are pretty self-explanatory about the damage that's potentially that could take place. I mean,
the damage that's already taking place without the clear cuts.
Right, and then when we get into the application of chemicals up above and fertilizers and herbicides and different things like that, where does it go?
Where does it go?
Okay, so.
Surprise, surprise.
I'll let that go. Yeah, my next issue would be on the lake management groups, the guidance that's been put together, the rules by Tim and company, I guess.
I have that packet on my desk to go through. I haven't gone through it yet.
It's, well, there's a lot of questions that are going to be raised about things like, at least with the older lake management groups, which would be Long Lake and Lawrence Lake, is those folks initially voted themselves to be taxed to do these clean water issues. And there was kind of how it was going to run through the county and the process that was going to take place. It appears to me that staff has put together some guidelines in those rules that disregarded concerns and the history of the way things have been done when the lakes folks voted to originally create these districts. So it's kind of like we're changing rules midstream, and there's a lot of people that are really upset with the communication process, the lack of input, that kind of thing. My phone's been ringing.
We have a briefing coming up, right?
Tomorrow you have a briefing with the
right.
LMD.
I mean, it's going to be pretty substantial, I think. So I just bring that up. Okay, it's more to come, huh?
Okay.
I don't know how you change the rules midstream. That's where I'm coming from. And I guess maybe we can discuss that more in depth.
That's what I'm anticipating, but I don't know.
It's my understanding that the meeting tomorrow, the LMD requested a meeting with the board and the board agreed to meet with them. So you have half an hour tomorrow to listen to what they have to say.
Okay, and at some point though, I mean, we haven't really gone through the admin stuff with, Tim started to at one of the meetings. I was at a training and I was kind of on my phone, but we didn't get very far because we got sidetracked with other issues.
Right.
But is that a board, did the board have to bless those, or is this coming kind of a policy from the Public Works? I think I remember Jennifer trying to argue to me that could be
It is a,
a more of an
it could be a department, just a standard of practice, but should the board want to review and approve any administrative process in a department, that is your
so there are more to
prerogative.
come on that.
Right, but tomorrow is strictly to listen
hear
to
to the
what
citizens.
yes, to hear what they have to say.
Okay. My last one is related to, it's kind of time sensitive. So we've got the Country Club road replacement, road bridge, and we're trying to get federal money. There's two different, I've sent NOAA, application. There's 4 different NOAA programs, and I'm told by Scott and Public Works that they're going after 2 of them that they think might fit. One of them is in, the deadline's like mid-August, one of them's like mid-September, early mid-September. I've been told by knowledgeable people that if we were to include, there's 2 more, like that's the Green Cove, creek, that's very sensitive in salmon bearing. There are 2 more culverts right behind those 2 that ultimately we're gonna wanna replace, and they're probably on our list. If we were to include at least design, engineering and pre-engineering, pre-design within the applications for these NOAA grants, we would strengthen our grant because we'd be telling a watershed-wide story. We would get the Squaxin Island tribe support, which we are not going to get just for the road replacement at Country Club. And we will, I wrote all the arguments down. We will get the Squaxin Island support. We can use there's a lot of grant writers, like the RIA 13 group has grant writers that can help us if we need to help with any of this, to backfill some of this. And something about the way the money, it is a 3-year program, good for up to 5 years, but the later years are gonna be more just backfilling things they've already sort of given approval to. So the most money and commitments to money is coming out in this first year. And so I don't know that I can explain the ins and outs of that, but I didn't hear anything that I was being told that, and the person that was trying to convey all this to me had a Salmon Recovery Council meeting, Noah was there, and there was a conversation that was had by our local people that work with me on the Salmon Recovery Council with the NOAA people that confirmed a lot of this information that I'm summarizing here, that we will have a better, stronger application if we have the tribal support, if we have a watershed story to tell, and we try to include that we're trying to look all the way up Green Cove, not just fix a road issue, because of so it will help us get money. So anyway, I am advocating that we follow that advice and include those 2 other culverts, pre-design work in these forthcoming grant applications with NOAA.
So knowing all the wonderful things that it would do to include them, why wouldn't we?
That was my argument. Or
And
that was my
the-
reaction to what I was hearing.
What was the answer to that? Are they not in the budget? Are they not on the CIP? Are they not in the TIP? What's the catch?
We probably have to talk to, I know that Teresa Parsons was available, and she was somewhat amenable to this according to the people I was talking to, but I don't know if it was timing issue, I don't exactly know. We probably need to follow up with our Public Works team and ask them, what's the downside here? Because I don't want to miss this opportunity to make a better application, get this money that we need for this really important project that the county needs, which is the Country Club. And if it helps us get, more fish passage down the road, that's awesome too, but, I'm talking to people that are absolute experts in how to write, environmental grants and dealing with NOAA. Cause that's in and around the salmon recovery world, those people's worlds are doing that. So I would highly caution us not to disregard their advice about what.
And who was it, who was talking?
It's I had this conversation with the lead entity, the RIA 13 lead entity coordinator, who runs the advisory group there and is my alternate on the Salmon Recovery Council and works with all the other, watershed planning, salmon recovery project, fish culvert, RCO, surfboard, all those places where this money, NOAA grants, they're experts in that. And so I'm just passing this on because I had the exact same reaction as you did, Robin. Why wouldn't we? And I don't think she didn't think it would be a lot of extra effort on our part. And if it is, and if that's the issue, they will help put those pieces in place to plug in.
So if you'll get me the specific information, I will follow up with Public Works.
Is that okay with you, Commissioner?
Yeah, but I think we should include our salmon restoration culvert changing group down at Public Works in this whole discussion. And I don't know, they maintain a list of culverts due to be replaced and maybe the benefit that comes along with that replacement. But I think the bigger thing that we should include in, I don't know, letter of support for the grant or whatever you're contemplating putting together, the fact that we as a county started before the judge ever made a ruling on culverts in general. We were, I don't know, a year or so ahead of the game on getting things lined out and prioritizing fish, I guess is the best way to put it, and the habitat. So I think that's well worth putting in the letter that, hey, all these other folks, they were mandated by the court to do this.
Yeah.
We were not mandated by the court. We took money that could have been spent elsewhere and prioritized fish. And so we've got a history of getting it done. And now we're asking for your help on this particular issue. And if we get that help, it will also move these other culverts farther up. You know, we'll get that done too. We'll do it all at once because it's a big issue.
I will include that element and I'll summarize this in an email and I'll include Commissioner Edwards' element so that you can share that with Public Works as well. If they haven't, you'd think they'd be putting that in if it's important, but we'll make sure.
All right, I'll see if there are any barriers to us putting those additional information.
Good to go then for this morning? We lost Commissioner Mejia, but I think we can catch her up. All right, well then,
Always more to come.
12:08, we'll be back at 2 p.m. for our regular board meeting. We're adjourned this morning.
Yep, thank you.